A very good afternoon to all. Education is the most powerful weapon which you can use to change the world. With these lines, I, Sapna Dhiman, Assistant Professor, on behalf of Delhi Pharmaceutical Sciences and Research University and Society for Alternatives to Animal Experiments, SAAE-INDIA, welcome today's chief guest, Dr. Y.K. Gupta, President, SAAE-INDIA, guest of honor, Dr. Raisuddin, Vice President of SAAE-INDIA, Dr. Akbar Shah, General Secretary, SAAE-INDIA, Dr. Vijaypal Singh, Vice President, SAAE-INDIA, advisory members of SAAE-INDIA, Dr. Thomas, Dr. Hajime Kojima, Dr. Christian Pennyworsen, Dr. Ankita Pandey, Senior Policy Advisor, PETA, India. We would also like to extend our welcome to live members and executive committee members of SAAE-INDIA who joined us virtually through Zoom platform. We also welcome our delegates around the world who joined us through YouTube link for the inaugural ceremony of 4th Annual Conference of SAAE-INDIA with the theme Latest Trends in Organ Culture and Organ-on-Chip Technologies. I also welcome directors, deans, professors, teaching, administrative, and supportive staff of DIPSR University. Now I request Professor R.K. Goel, Honorable Vice Chancellor DIPSRU, to felicitate Dr. Raisuddin, Vice President, SAAE-INDIA. I also request Professor C.R. Patil, Organizing Secretary, and Dr. Mukesh Sir to kindly join. Now I again request Sir to kindly felicitate Dr. Ankita Pandey, and I also request Dr. Anu, Dr. Sachin, Dr. Ajit to kindly join. Thank you. I request all the respected dignitaries on dais to please step forward to begin the lamp lighting ceremony. Deepa Jyotir Par Brahma, Deepa Jyotir Janardhana, Deepo Harthu Me Papam, Deepa Jyotir Namastute.
Madam, please.
Thank you. Now I requested Dean Academics Professor Geeta Agrawal to brief about the DIPSA University.
Good afternoon, everyone. Honorable Vice Chancellor, Professor Ramesh K. Goyal, Professor Y. K. Gupta ji, Chief Guest of the Day, Dr. M. A. Akbar Shah, Dr. Raisuddin, Dr. Vijay Pal Singh, Dr. Ankita, all dignitaries, guests, speakers, my dear colleagues, and all the participants present online and in offline mode. I'm pleased to share with you all the academic and research activities of our university, DIPSRU. Dr. Sapna, please allow me to share my screen.
Yes, ma'am.
Yeah, is it visible to everyone?
Yes, ma'am, it's visible.
Yeah, thank you so much. The university DIPSRU is the first pharmacy university of the country. Slides are not moving here. The university started in 2015 with the legacy of more than 56 years of DIPSA. From 2015, the university is growing and we are adding many departments and courses in the university under the leadership of our Honorable Vice Chancellor. In 2021, we have added various courses and skill courses, including skill courses. And from this year, we are adding 10 new courses in the university. So this shows how the university is growing. Just a minute. About the university, if you see, we are 100% grant in aid university from the state government. The university is running various courses, including B.Pharm, M.Pharm, and M.Pharm with 13 specializations, including physiotherapy, Masters in Hospital Management, Public Administration, MBA, Sports Pharmacy, and skill courses. Along with it, university has its own incubation foundation with Bioness Center, Precision Medicine and Pharmacy Center. We are also running various skill courses which are collaborated with DTT, and the university is guided by various experts, including strong General Council and BOG members. If you see the General Council members, we are having our Anil Bejal Sarji, that is Lieutenant Governor of Government of NCT of Delhi, who is the Chairman of General Council. We also have Shridhar Dwivedi sir, along with experts from the industry and IPC who are guiding us continuously. Similarly in BOG, We are having representatives from the industry, academia, and various research organizations. At present, university has 9 units, which includes DIPSAR, School of Pharmaceutical Sciences, School of Allied Health Sciences, School of Physiotherapy, Sports Science Department, Incubation Foundation, Meditation and Yoga Center, World Class Skill Center, and then Bio Incubator Center. University had various centers in its previous year, but in the last 3 years, 4 centers are added, which includes Bioness Center, Precision Medicine Center, Meditation and Yoga Center, and Center for Advanced Formulation and Technology. Center for Precision Medicine and Pharmacy, it is supported by DTT with grant of more than 5 CR. The main purpose of establishment of this center in the university is the research in the area of drug development and drug discovery. The center is going to support the research and training in various courses and for various equipments, and it will promote innovations in the area of drug development, diagnostics, treatment, and clinical trials. Center for Meditation and Yoga Sciences, it is inaugurated in 2021 only. It is the initiative of Delhi government, where the center was inaugurated by our Honorable Chief Minister Kejriwal ji in June 2021. And under this center, we are running diploma as well as certificate courses. DIPSRU Innovation and Incubation Foundation, where company was incorporated in 2017, and further it is supported by Bionest. Incubation Foundation was established with the vision to be recognized as prestigious Indian incubation center in healthcare, pharma, and wellness center. And we are working in this area. The area is not limited to formulation development, but it includes all the areas related to healthcare, which is packaging, data solutions, community health, wound healing, biomedical devices, diagnostics, formulations, etc. This center, as I have already mentioned, is supported by Bionest, which is funded by we are having more than 18 incubatees, and at present 10 incubatees are active. All other incubatees, they are graduated, and more than 6 have got success through our incubation foundation. We are also supported by various companies with the CRS activities. Recently, we have got grant for Center for Advanced Formulation Technology by DSIR, DST, where the main purpose for the development of this center is to provide one-stop solution for the advanced formulation development. And this is going to be one of the best center in we can say in the North India, where we are going to support MSMEs. As per the mandate of the center, we need to register more than 100 MSMEs with this center, and we have started this work in the university. We have signed various MOUs with the industry, and we are conducting and doing various projects. This center is going to support various sectors, including pharmaceuticals, herbal, biopharmaceuticals, nutraceuticals, and cosmeceuticals. And it will be supported by pharma companies, research institutions, and we will provide training to students, startups, etc. The strategy of this center, that is, we are already having Bioness Center, BABE Center, Precision Center in the university, and with this center, we will be able to provide the one-stop solution for the development of the formulation, which will include from the drug discovery to development and formulation development, and all the studies including preclinical and clinical testing for the developed formulation and new drug molecules. In terms of research activities, university is growing and again doing continuous efforts. The faculty and students, they are publishing papers, of course, in good journals. Faculty is getting various awards, conference participations, and conduct of various conferences in the university is a regular activity. Various patents are being filed by the faculty. 12 patents were filed 2018 to 2020, but after that, more than 6 patents are again filed by the faculty. In terms of research grant, university is continuously getting the grant. In 2021, only from Jan to December, we have got more than 12 CR of grant from the various government agencies in addition to other funds that we are getting from the government. DIPSRU always connects through conferences, workshops, QIPs, and guest lectures with various research organizations, international and national level organizations, where our students participate in all these activities. Faculty is continuously being trained in the university through various QIP and programs and FDPs. This is again a very interesting slide where you can see the result of GPAT. The students of university, they are getting, they are qualified every year in the GPAT, and in this year again more than 50 students qualified GPAT. And if we see the percentage, we have found that we are being the first one in the country where maximum number of students have qualified GPAT. Even the first and fourth rank in the GPAT was grabbed by our students. Placements, more than 80% of the students of the university every year get the placement. If we see world's top 10 companies, out of them 6 companies, they visit our campus every year, and students are being placed in these type of companies. We are not collaborating with companies only for the placements, but in terms of trainings, collaborative projects, we are working in this area too. The university is of course, the first university in the country, but we are also working so that we are going to be first in various areas. We are having first ocular pharmacology lab in the pharmacy university. Our honorable vice chancellor was conferred upon honorary professorship by the Stavropol Medical State University. We are also running BSc honors in sports sciences, which is again one of its type of course. Skill development courses in sports university is running, and various students are being trained under this center for the skill development. Products are being launched through the university. Similarly, university has also worked in the area of pharmacovigilance and is continuing with that. This is the launch, that product was launched by the university. And now again, under the leadership of our honorable vice chancellor, product, a herbal formulation has been developed, which is chloroquine zinc formulation, which has been developed with the collaboration with Arabli Biodiversity Park and companies including Remedium and Jami, where the team of the university has worked with these companies, biodiversity, DDA biodiversity, for the development of this formulation. And this formulation has been found to be effective for the treatment of COVID-19 and post-COVID effects too. University has signed MOUs with various national and international organizations, hospitals, industry, but all the MOUs have been signed with the outcome, that is either we are doing the projects or we have completed some projects with all the organizations where we have signed the MOU. Internationally, university is again collaborated, where the university has participated in various events and again working on various collaborative projects. In DIPSRU, the work is not, we are not limited for the publications and doing various research and through PhD and MPharm students, but the main target is development, where our students and faculty have shown that these products can be developed as the product of the research in the university. In the COVID-19 pandemic time, these various products were developed, and we are very hopeful for our new formulation, chloroquine zinc, in the coming time. Thank you everyone.
Thank you, ma'am. Now I request Dr. Raisuddin, Vice President SAAE India and also Professor, Department of Medical Eliminatology and Toxicology, Jamia Hamdard. Sir is also the founder member of SAAE India. So please.
Okay. So I'm online. Is it okay?
Yes.
So thank you very much for this opportunity, Honorable Vice Chancellor, the President of the Society, Professor Y.K. Gupta, and I'm the Vice President. Another Vice President is Dr. Vijaypal Singh, who is working with the IGIB and also FASI for a very long time. And then the General Secretary, our very beloved Professor Akbar Shahji. So it's a great opportunity today that we are assembled. And on the insistence of very enthusiastic Vice Chancellor, we converted our meeting in the hybrid mode. So good number of research scholars and students are there. I welcome you all and faculty members in this program today. And Vice Chancellor in his personal self is present here. So we are very enthused to see the leadership of DIPSURU, a very eminent university in the field of pharmacy. And this is one of the initiatives of government now. They have University of Forensic Science in Gujarat, Gandhinagar. And I think that has developed in a very big way. And this pharmacy university will also be taking new leaps and bound in coming days under the leadership of Professor Goelji. So this society meeting is fourth one. The first meeting was held at our university in the month of November, and the second was held in Mumbai, again in the month of November, December, and third meeting was held in virtual mode. But all meetings were attended by a good number of international participants, not only from the neighboring countries, but also far away from America, from Japan. Especially Japanese scientists are taking a lot of interest, and from South Korea also, people are getting close to our society. So this society is, is a young society, still in the fourth year, registered in 2019 at the Tiruchirappalli in Tamil Nadu, and taking shape. But I am happy that lots of interest is being shown by all stakeholders, not only from academics, but also from industry, to join and contribute to the development of this society. So thank you very much. And if I can get my PPT. Yes. So briefly, I will tell about the history and background of this society. And this society, as I said, is not a kind of conventional animal rights society. People should not be confused. We are for the animal research, but in a humane and rational manner. And also we promote that if it is possible to explore the alternative models, like conventional race test has been replaced with more humane and more even not requiring mammalian or rabbit to perform that. Similarly, lots of tests, skin sensitivity test, and even these corrosion test, skin corrosion test. There are alternative. Even human reconstituted models have been developed, and I think on that we have workshop also by very good friend of our society, Christian Polevoisin, from this. So that way, I think universities are the right platform for making such a change. In fact, this is not a tradition in our university. So in America, you see that best of the policies of the country are generally declared by the President of America in the university, on the university campus. You see that president used to visit the, whosoever president is there, they will visit the universities and they will announce their policies. But here in our country, this tradition is not there. Our Prime Minister only visits during the convocation time and gives lecture. But universities are in fact the change. Most of the Nobel Prizes are won from the university medical college or university departments. Generally, they are not won by like we have our CSIR or DHT or DBT institute. So this university is very much specialized in pharmacy, and domain area is very much very much specialized and the need of the hour. And I think, as everybody knows, that major contribution to the GDP of India is made by pharmacy industry, pharmaceutical industry, contributes to the major chunk of our GDP growth and also GDP in real terms. So pharmacy and pharmaceutical scientists have major role to adopt such kind of changes. So this society, as I said, animal loving has been part of our culture. As you see, our father of nation is with a goat, and he once told that the greatness of a nation and its moral progress can be judged by the way its animal are treated. So Mahatma Gandhi once said that any nation is great if it greatly cares and treats animals in a right way. But it is a tradition, our tradition. I can show you many pictures that in our country you can see even animals are very much respected. Sorry, the previous wala dikhlao, usse pehle wala, that way. So what I said that all forms of animals are in one way. It's not I'm not giving in a funny turn, but serious turn. People love so much animal. Our prime minister can be seen feeding a goat, and people worship and love cow. And they love snake, all sorts of animal, even mice are rats are fed in certain temples, and they are maintained properly, surviving in good ecosystem with the humans. So it is not that everybody is dying because of plague, some rat is there. So rats are living in good ecosystem in many temples we go, in even sometimes dargah, these majars, these all animals are living together, surviving happily, and there is no dispute between their territory and their rights. So this is there. And even in India, even animals also respect human. You can see the one monkey is giving ashirwad to a person. So, so it's a reciprocal. I found some picture. So it's a real term. People love to get blessings of animals, and animal love to get blessings of the animals. So this is, we will know that Ansa Parmo Dharma is our motto of our country. So it is non-violence. Mahatma Gandhi, we won our freedom on the principles of ahimsa only. So this is not a new trend that animals are loved. Long back in 1874 rather, Bombay Society for Prevention of Cruelty to the Animals, BSPCA, was established by the Sakrabai Dinsha, the Petit, these are Persian people. They established first hospital in 1874. Around 150 years back almost, they established a hospital for animals in this. So in fact, if I am not right, PETA was established sometime in 1960s or 70s in New York. So very 800 years back after this event, PETA was established in New York. And the Sakarabai Dinsha Petit Hospital for Animals was also founded by Sir Dinsha Manokji Petit in 1883. Itne saal pehle, about 130 years back, this hospital of animals was established. So this tradition, this culture, and this kind of things are not. We talked about the other thing that people love animals because of their faith or religion, but not only that, people love animals in real sense. When even this PETA was established about 100 years after this event, and in India it was established sometime in 2002 in Bombay, something. So that kind of thing is there. So this society is there. Then we have a vibrant center for this animal research, alternative animals, as from Tiruchirappalli at Bharati Dasan University, where Professor Akbar Shah was there serving as a professor. And they established UGC National Center for Alternatives to Animal Experiments. UGC, not now, but earlier UGC used to support certain kind of center for excellence or area studies. So, for example, in our university, they have a study center for federal studies. So these kind of earlier, but now I think funding pattern is different. This scheme is not supported, but very long back, this center was established. And then this center, as I said, was established at Bharati Dasan University, National Center. And finally, in 2019, this society for alternative to animal experiments was established, for which we have the fourth meeting. It is registered society, and our accounts, everything is audited, and we are under the purview of the government rules and regulation. And but though it is registered in Tiruchirappalli, Trichy in short we call, in Tamil Nadu, but its area of operation is whole India. So these conferences are held in Bombay, now in this year in Delhi. So the main goal of the society is to promote humane education systems by way of introducing alternative use of animals in education, research, and testing also. The pragmatic translation of which will be promoted by the concept of 3 R's. Everybody know the 3 R's concept: reduce, replace, and refine. So this is there. The other goals I would not read one by one. One is to promote adoption of practices of 3 R's in India, to network with the stakeholders, like we are networking with institutions, industry, and other stakeholders, to government policy makers also. For example, Dr. Vijay Pratap is very vocal and member of many that CPSEA, that is Animal Ethics Committee, Central Committee, and active member. To governments as well as industry as well as academia. Academic, we are not focused on only the academic departments or the university or the institutions, but also with the industry, to arrange scientific meetings like we are having, to sensitize the regulatory authorities. We are, especially when Dr. I think Dipti Kapoor was there, who unfortunately expired 1 year back almost, and very active member. In her place now, Dr. Ankita Pandey is there. So she is also pursuing with government authorities, Ministry of Health, CD, SEDESCO, etc., to adopt the alternative models, and like that, to provide and organize courses, training courses also, like we have training programs, workshops, etc., in between and during and after the conference and pre-conference way. So this is office bearers, Professor Y.K. Gupta, eminent pharmacologist, and also scientific administrator, retired very recently from All India Institute of Medical Sciences, very #1 institutions in pharmacy, these medical sciences, and currently he is associated with THSTI, that is Translator Health Science Institute. I am the Vice President, Vijay Pal Singh. Dr. Akbar Shah is there, who is the research coordinator in National College of Trichy. After superannuating from Bharatidasan University, he got associated, very active. You will never feel that he is retired person. I envy him and feel jealous about his activeness. Please don't mind Akbar Shah. And Dr. A.B. Pant, who is a scientist, and Ankita Pandey is his student, PhD scholar. He is working on an in vitro model at Indian Institute of Toxicology Research. Dr. Adip Rai is also product of Indian Toxicology Research Institute. Currently is working at a senior position in Amway, India. And then Dr. V. Kandamani is our treasurer at the Bharatidasan. And we have some members, EC members there from Tirumani, Muhammad Amin Nazir from CSIR, CDRI, Dr. Sohel Parvez from our university, PB Mohanan, Sri Chitra Institute, Subramanian Bangala from Riajin, Biosciences Industry person, Uman V. Oman, very senior professor from University of Kerala, and Dr. Pratiksha Alag, and Syed Ziaur Rahman from Pharmacology Department of GN Medical College, Aligarh University, Rohit Seth, Irfan Tamboli. These are the members. We have also 3 international and 1 PETA nominee will be always there. Parveen Bansal from Baba Farid University of Health Sciences, Faridkot. So international, whole nation spectrum, people from South, North, West, East are there. And Muhammad Idris from CCMB, very renowned institute, and working on zebra fish models very extensively. And I think he will give some demo also. Suresh Posala from Onco Sikh Bio, Hyderabad. 1 nominee from PETA. I forget about Rohit Tamboli. is Jai Research Foundation is one of the very big CROs in toxicology field located in Gujarat. And then we have three international advisors, Thomas Artung, who will be speaking, John Hopkins University, and Hajime Kojima from Japan, and Kishan Pellavazin. All these people also will be interacting and talking to you. And these are the events, like first event was organized in Jamia Hamdard in New Delhi in 1980, inaugurated by Dr. Renu Swarup, who is Secretary to the Biotechnology Department, Ministry of Science and Technology, attended by in person many guests from Japan, South Korea, USA, and other France, every place, because that time was happy time, no corona on horizon. So, and then in 19 also, same way it was organized at Khalsa, very big. Khalsa College is like a university there, big college in Mumbai, and they have one center for pharmaceutical research and biopharmaceutical research in there, supported by DST. And then during that conference and the previous conference also, we have a pre-conference workshop in IDMOC at the University of Kerala, and then post-conference, meeting conference was at Hamdard, Jamia Hamdard. And then here also some pre-conference workshop on IDMOC and zebrafish at Kerala University, Thiruvananthapuram, and post-conference workshop at National Facility for Biopharmaceuticals at Khalsa College, and then in Jamia Hamdard also. Now, because of the COVID, the third event was organized in a webinar mode again coordinated by Bharati Dasan University and speakers from India and abroad. Now, this is the fourth conference, and I much thank the Honorable Vice Chancellor for allowing us to have conference in each campus, and other members of the organizing committee who accepted this challenge in very testing times. And Honorable Vice Chancellor suggested that we should have in a hybrid mode, taking all precaution whatever possible to avoid any kind of cross-contamination and contagiousness. So this is the fourth conference at DIPSRU, a very renowned university. As just now Dr. Agarwal presented the profile, I am very much impressed. So much number of students, qualified GPAT, and lots of industry collaboration and innovative research centers have been established. So I hope that BC Saab will also think for establishing a center for alternative research. Just small, maybe society can be a partner in that and guide you. And with limited resources, with maybe pharmacology department or translation research department, it can be conceived and established, and it will be very unique facility for research on alternative. Maybe PETA can also be partner and provide them support, not only just advice, but some dollars also. So this conference, I don't much speak because the organizing secretary will speak about the conference, what are the kind of, but they have lined up a very good array of speakers from India, from abroad, and from Japan, from France, from America, from Trivandrum, from Lucknow, from Delhi as well. And then they also have many workshops. These workshops will be held at various places. And this one first workshop, Christian Pellavazin, and then this Albert Lai. There is some change, I think Dr. Patil will communicate about this program. Some schedule will be, I think, here and there. And then another workshop will be conducted in our department, Jamia Hamdard. We have three alternative models established. One is zebrafish model. Second one is the C. elegans model, nematode model, fish model, and fruit fly, that is Drosophila melanogaster. Professor Sohail Parvez is a young professor in our department. Basically, he did PhD under me in 2000. Then he went to Hawaii, America, Queen's Hospital he worked. And then he came to Germany. He worked postdoctoral fellow at the Magdeburg University in a very renowned neurology center. And then later on, he came to Jamia Hamdard as an associate professor in 2010. And now he is full professor. And he will be making And Amin Nazir is also our student. Basically, he did MSc from Department of Toxicology, and then he did PhD from Toxicology Institute, IITR. And then I guess he's a student of Dr. Alok Dhawan, who was director there. And then he published good papers, and finally he became scientist, principal scientist, and head of the toxicology division in Central Drug Research Institute, Lucknow. So that way, the organizers have laid out very good conference and very good pre and post conference events. So I must thank them, and I also wish them all the best. Those who will be organizing and those who will be attending, it will be really treat to attend all those things. And as in they have very nominal registration fee or kind of no registration fee. So sometime it is required to maintain and to support these even website development, etc., etc. And Vice Chancellor has also extended his generous courtesy to support this organization of this conference. So now my simple appeal is that please join the membership. When I was a student, and first thing I would do, sir, when I get my fellowship, that time it was 1800. When I joined, it was 1200 only. And then after few years, and sometime we admire Mr. Rajiv Gandhi ji, he was very keen to increase fellowship that time. So he made 18, so and then 22. Then when it became 2200, not 1000. So we were very happy. So then I start becoming member of that society, Toxicology, Society of Biochemistry, Environmental Mutagen Society, that society, this society. So every month I will become one member. That time, lifetime membership was 1500. No, 500, sorry, 500 only. And the same now is 5000 because fellowship amount, salary, and cost of everything has increased. So it was easy for me. Even this 5000 membership, 2000 membership is nowadays okay. Life membership. Till your life, you will be member. So become member, join it. You will get membership benefit, as well as you will get invitation and notices about conference. Sometime, for example, there is society, this IU Talks, International Union of Toxicology. They want that you should be member of the national society. Then they will provide you award. So one of my students was member. So she was provided $1,500. Good, 1500 into 75, good amount, about 1 lakh rupees. So she went to Mexico to attend. So they asked that, are you member of? Then they needed a recommendation from a member or president or vice president. So I was member and president also, Society of Toxicology even today. So I gave, so she got. So that kind of benefits are also there because you are in research, you will pursue research in university department or in the industry or in some CRO or in some kind of organization. So these memberships are very helpful. Students, don't take student membership, take life membership for 5,000. It is for all years. Then we need to launch some regional zonal chapters. Next event, I don't know where we will have, but if some members who are attending, they can propose their venues. Adopt alternatives in research and teaching. A special call to pharmacy community. I think you just there are many tests. There are many, especially in pharmacology, where there are already alternatives are available. Simulations are available. Alternatives are available. So instead of using a whole animal, or instead of talking LD50 determination or something where large number of animals are to be sacrificed, just to know something, to know very sometimes very useless data, and to create some data, and to sometimes meet some requirements of the regulatory affairs. So please, it will be possible. And also we can, like senior people like Professor Goel and others, they can also pursue with the regulatory councils to adopt syllabus with alternative. Ask pharmacy council if it is, I think they have some in vitro concepts in syllabus. So at least in pharmacy, the pharma syllabus or diploma pharmacy or course, they can induce 2-credit course for this kind of alternatives. And with this, I think this must be my last slide. I thank everybody for joining online, offline, and I wish all the best to the organizers, young people, Anup and Dr. C.R. Patil and his team. And I think since Vice Chancellor is, I tell him that your Vice Chancellor is with you, don't worry about that. So very important that you have support of your head of the organization. So things become rather easy and you get, and thankfully it is online. Sometimes it is offline, you need to arrange shamiana, tambu, kanas, the dinner, lunch, chai, biscuit, and certification and memento and this. Lots of money is saved in this online mode. But still, you offered me very good lunch. Thank you very much.
Thank you, sir. Now I invite Dr. Akbar Shah, General Secretary and also founder member SAAE-INDIA, who joined us online to brief about the 4th annual conference of SAAE.
Yeah.
Yes, sir.
So very good afternoon. Am I audible?
Yes, sir. Yes, sir.
Yes, sir, you are audible.
Yeah, I can continue. Can you bring me to full screen?
Yeah. Yes, yes. Yes, we can see you now. If it would, can you arrange some light source on your face?
So very good afternoon. It's indeed a very personal privilege to be taking part and addressing the audience present and audience who are attending to the online version of this great conference. My very pleasant good evening to good afternoon to all of you. I should very particularly mention about Dr. Professor Goyal, the Vice Chancellor of the Delhi Pharmaceutical Sciences and Research University, Dr. Chandra Gowda Patil, the Professor of Pharmacology at this university, and the colleagues in the various departments of this university. My dear President, Dr. O.K. Gupta, the Vice Presidents, Dr. Raisuddin and Dr. Vijay Pal Singh, the Joint Secretaries, Dr. The Vice Presidents, the Joint Secretaries, the Treasurer, and all my friends in the Executive Committee, all those who are attending this conference. It's my very pleasant privilege to be greeting you on this very pleasant occasion. I'm extremely happy that the 4th conference of the society is hosted by the Delhi Pharmaceutical Sciences and Research University, and being spearheaded by my good friend, long-time acquaintance, Dr. Chandra Gowda Patil, the Professor of Pharmacology, taking up the responsibility of being the organizing convener and taking up the full responsibility, shouldering the big responsibility of conducting this wonderful conference. Well, Dr. Raisuddin, our Vice President, has given a very good narrative of the background and the profile of the Society for Alternatives to Animal Experiments, India. There are a few things which would fill the gaps. To bridge the gaps, I will start with the international scenario of the 3 R's, the replacement, reduction, and refinement concept of the great visionaries, and starting off from the 3R concept in 1959. Great many things have been happening in the scenario of animal use in the various contexts of teaching, research, experimentation, testing, drug discovery, and whatnot, even in vaccine development. So great many changes were taking place since 1959. And particularly rapid strides were made in many countries in the European Union, the United Kingdom, the Germany, France, the Netherlands, Italy, Praha, and many other countries in the European Union. And on the other side of the thing, you have the United States of America, and Canada also is catching up in the recent times. And Far East, we had Japan putting a lot of effort towards emphasizing alternative methods or non-animal methods in various aspects of experimentation, research, and teaching. So when these things were happening across the globe, in India, almost parallelly, activities were initiated. But in the early days, as you all know, the animal care, animal concern was essentially in the hands of the non-government organizations or the voluntary organizations like People for Animals, the PETA, the Humane Society International, and a few other small organizations. They were spearheading the movement of animal concern. You don't call them really alternatives, but more about animal rights and animal care. And in course of time, slowly, it was realized that a lot of animals are used in education, in research and testing, and in drug discovery. These domains attracted the attention of these voluntary organizations, and they started giving attention to things happening in these avenues of scenarios of animal use. And at that time, they needed people from the academics. The R&D organizations realized the importance of academics who would speak to the stakeholders about the non-animal methods, rather than the animal rights organizations emphasizing that concept. So that is how many of us, like me, Professor Krishan Sharma, Professor Satyanarayana, and a few others, Vijay Pal Singh, we got into the animal alternatives movement in India, essentially independent of the things happening around the globe. And slowly, it so happened that because some of the research and teaching community got into this activity, supporting the voluntary organizations, we thought we should all work together, the academic community, and we should work together to emphasize the alternative movement in this country. So it is by this time, I had an invitation from Dorenkamp Binden Foundation in Switzerland, who had realized the great use of the extensive use of animals in the various domains of experimentation. So the organization, the Dorenkamp Binden Foundation, invited me to establish a center for alternatives for the whole country and to place it in the Bharatdasan University, from where I was retiring from regular service at that time in 2008. So that's how dramatic changes were taking place. NGO was taking care of it. And then an organization from Europe supporting establishment of a society, establishment of a center in India. The objective of that center was to propagate the message of alternatives across the country in education institutions, in research institutes, in industry, and so on and so forth. So this center, the Mahatma Gandhi Dorenkamp Center, was requested to take care of the curtailment of animal use in these various domains, right? So that is how I got into this scenario, and I started the activity, and we went. I had a small team of people who supported the Mahatma Gandhi Dorenkamp Center in this endeavor. So we went about meeting people across the country, and slowly the momentum was gaining, and we did great many things. And many of the friends who are in this society are those whom we met during these visits, and so we have. This project, the Mahatma Gandhi Dorenkamp Center, was meant to be spreading the message of alternatives, to sensitize the people about the alternative methods, and more importantly, is conduct training workshops in the Bharatdasan University Center and elsewhere in many places across the country. Train people to change to alternative methods. So training was considered a crucial aspect of it. Thus, we had the Mahatma Gandhi Dorenkamp Center, and the tenure of the center was going to be over. At that time, we worked with the University Grants Commission. which was willing to support, take over this center as a national facility, which Professor Raisuddin mentioned. And it was also realized that over and above the center, the national center, we need to have a society, because it is the society which over and above sensitizing the people and carrying out spreading the message of alternatives. We could also knock at the doors of regulatory authorities, like for example, DCGI, the ICMR, the Department of Biotechnology, the Department of Environment and Forests, and these and the regulatory authorities. We could motivate them, request them to regulatorily introduce alternative methods which are already introduced in other countries, and encourage research towards alternative methods. So that's we thought we have a society, and that is how the Society for Alternatives to Animal Experiments came into existence. And we of course we initiated activity in 2018. But the society was regularized through registration in 2019. So we had a conference 2018, 2019, 2020, and so we now come to the current conference, which is 2021. So when it was, first was offline, we could meet. The second was offline, we could meet in Mumbai. And the third, of course, we were caught in the clutches of the COVID-19. So we had to go by online mode. And that being the first experience, it was not much of an excitement in 2020. But over the next 1 year, many things were happening through the online mode. Virtual conferences have been gaining momentum. So we thought among the senior people in the society, we thought the time is not right for us to go for offline meeting, in-person meeting, so we go for online. And looking for the person who will conduct it, well, the lot fell on Dr. Chandra Gowda Patil, the professor of pharmacology. Dr. Patil is known to me personally for well over a decade. We used to meet in many high-profile conferences. He is the person who has been propagating the concept of alternatives among the students of pharmacology and pharmacy, right? He was working at that time in the College of Pharmacy. So he was doing this at the Pharmacy College in as much as I was doing it and a few others were doing it in the Arts and Science, Basic Sciences University. So Dr. Patil is known to me for well over a decade. So he moved into Delhi, to the Delhi Pharmaceutical Sciences Research University. So we took advantage of that, and we requested him to conduct this conference. And we are really very happy that we have a very proactive professor, a scientist as Vice Chancellor of this particular university. So when Professor Patil put across the thoughts to the Vice Chancellor, so the Vice Chancellor was really very happy and very, very proactive. And he encouraged Dr. Patil to have the conference done there. We over the period of the organizing of the conference, we had 2 online advisory committee meetings, in both of which Dr. Vice Chancellor participated and motivated us, and he offered to have a small online platform also, offline platform also, so that this conference would be considered as we're going on the dual mode, offline and online. So wonderfully, we have just over the period of 4 years, starting in 2018 to 2021, the society has made very rapid strides, and we have association even today with the voluntary organizations, the People for Ethical Treatment of Animals, Humane Society International in India, and we have also the patronage coming from many international societies. Like, for example, we have the Japanese Society for Alternative Animal Experiments, with whom we have a memorandum of understanding. We have our Japanese colleagues participating in all meetings starting 2018. This time also they are participating, and they have this time they have 2 companies, 2 industry representatives going to share with us their experiences of finding newer alternatives and producing replacement alternatives. So international patronage is there. We have Korean Society for Alternatives supporting us. The American Society for Cellular Computational Toxicology is supporting us. The USAT, European Society for Alternatives to Animal Testing. I can go on listing like, no, I don't have any slide. So this is all sharing my experiences with people who are present in person and those who are listening to me. It has been a very pleasant experience for me, establishing this society with the help of all my good friends who are members of the society and many who are yet to become. And it has been a very, very, very pleasant and satisfactory experience to have moved the alternative scenario to the forefront in India. So it was not an entity 10, 15 years back, and it has become one of the very serious topics and subjects. And the trend we have started contributing to alternatives, like we have many of our members are contributing to newer alternatives. I can make mention of like Suresh Kosala, Ankusik Bio in Hyderabad, Dr. Subramania Wangala, who is also associated with Yajin, another company. We have Dr. Mohanan, who is from Sri Chitri Tarnal Institute. I mean, these and many more are associated with the most recent direction of alternative, the organ on chip, right? And organ on chip, organoid on chip. India is also contributing to these trends, and I thank my colleagues whom I mentioned. They and very many are participating in the research in these areas. So I have taken you through a passage of history of establishment of the alternatives at 3 Rs from Russell and Brett in 1959 to what is happening globally in the form of organ on chip, which has become very popular and doing take place with the regulatory recognition. And in India also, we have been making very rapid strides. So having said what has been happening around us in India, I can't have much more time than this. I should very particularly thank the Vice Chancellor of the host university and Dr. Patil for the effort and shouldering the responsibility. And we have been, I said, we have been very strongly supported by people from industry. I mentioned a few of the industries like Unilever, like J Research Foundation, Angusik Bio. That's the kind of support we're getting. I mentioned about voluntary organizations, PETA India, people for the Humane Society International, and very particular mention should be made about the kind of a collaboration which has come up with the FP Skin, the reconstructed human epidermis people who are a subsidiary to L'Oreal. We have gone into very good, very wonderful association and collaboration. And interestingly, over and above about a dozen workshops, which the Episkin people, particularly Christian Belwisen, has participated and conducted in India in association with the MGDC, with the National Center, and then our society. He has gone a step further to contribute an amount of 1,000 euros to award best oral and best poster presentations in the annual conferences of this society. And in this conference also, they have agreed to give the money, and we are expecting the money to come. We don't wait for the money to reach. We will award the prize, and the money will be reimbursed. So it has been very pleasant, happy, and fast going. And when these things were going very fast, a third thing happened, and that was the sudden demise of a very good person in Dr. Dipti Kapoor. She was representing the people for ethical treatment of animals in our society as an executive committee member. PETA is an organizational member of our society. J Research Foundation is an industry member of our society. So PETA nominee, Dr. Dipti Kapoor, very unexpectedly at the age of 39, she passed away through maybe cardiac arrest, and we miss her. And there was a sudden spurt of activity. Our colleagues coming up to say that they will contribute towards establishment of Dipti M. Kapoor endowment. So we have the endowment established, and we have with us Dr. Angita Pandey, who took over the place of Dipti Kapoor in our society as the PITA nominee in the executive committee. She's there in the offline in the inaugural session. So I would now, having said briefly about the progress made and the present conference, and I would now take leave of my friends and ask Dr. Ankita Ponte to share her points about the establishment of the Dipti Kapoor Endowment Fund. And having said this, I thank you, thank the Vice Chancellor, thank Dr. Patil, thank all of you for your wonderful opportunity and wonderful hearing. Now we will listen to Dr. Angita Pandey. Angita Pandey, please.
Thank you so much, Dr. Akbarsha, and good evening to Honorable Vice Chancellor Professor Goyal, President Dr. Y.K. Gupta, Vice President Dr. Raisuddin and Dr. Vijaypal Singh, General Secretary Dr. Akbarsha, to the organizing committee, and to everybody who is attending this inauguration ceremony offline and online. So it's indeed a pleasure to be here and address this audience today. And I would like to take a little bit of moment to talk something about Dr. Dipti Kapoor. So Dr. Dipti Kapoor was one of the founder members of Society for Alternatives to Animal Experiments, India. And in the 2 years of time that I've known her, working with her, I would say that she was a firebrand of animal rights. And she was absolutely fiercely passionate about this cause. And her willingness to approach the even most committed proponents of animal testing with a warm heart and a kind smile is something that actually granted her access to even the most higher senior officials at any organization or a regulatory body or even a company. And in fact, she's even been instrumental for bringing about huge wins for the animals and science with her untiring efforts. Unfortunately, with her untimely demise, the animals, they've lost a champion. We have lost a dear friend, and there has been a void created in the alternatives movement, which would be difficult to fill up possibly. Having said that, the society, in order to honor her memory and acknowledge the contribution she's made towards the alternative movements, they've decided to institute an award in her name. So the name of the award is Dr. Dipti M. Kapoor Endowment Award. And it's basically to support an early career researcher that's working towards the field of alternatives or animal-free testing methods, or maybe a person who is also working towards bringing about policy reforms, regulatory changes, and social reforms to replace and reduce the use of animals in research and testing. The society has been able to successfully raise good amount of funds thanks to contributions received from Dr. Dipti's family, society members, friends, and well-wishers. And the award basically includes a good amount of cash prize along with the society taking care of the awardees' travel and accommodation to the society's conference. It's only open for Indian citizens up to the age of 45 years of age, and the awardee would be selected by a jury comprising of 3 members, 1 from society, 1 from PETA, and 1 international expert. And the first award would be given in 2022. So with that, I would really like to thank the society on behalf of PETA India to come up with this excellent initiative. And I think this would be the most beautiful and kind way of remembering Dr. Dipti and all her contribution towards this alternative field. Thank you so much.
Thank you, ma'am. May I now request Professor R.K. Goyal, Honorable Vice Chancellor, DIPSA University, to address the gathering with his valuable views.
Thank you, Dr. Sapna, for this. Thank you, Dr. Raisuddin, for considering this as a venue and also to have the blended mode. President and my friend, colleague, Professor Y.K. Gupta, the President of the Society, General Secretary, Dr. M.A. Akbar Shah, the other Vice President, Dr. Vijaypal Singh, the advisory panel, Dr. Thomas, Dr. Hajmi, Dr. Christian, and many others, including Dr. Pandey, who are going to be the speakers. My colleague, Professor C.R. Patel, who was known to me for many, many years as a student to all this, to the current stage. My other colleagues, Dr. Mukesh Nandwe, Dr. Anu, Dr. Ajit, Dr. Sachin, who are sitting in the audience, deans, directors, and all those who are attending this inaugural session. Well, my task has been made relatively easier, so the presentation I would like to be a little brief because the time is also been little more. To Dr. Raisuddin, I am really elated to meet you today, honestly, and I extend my full support. I will rather request at this stage to my colleagues, pharmacology colleagues, to prepare a policy wherein this membership also can be part of staff welfare measures. Do that. Yes, we will take it to F3 and do that. And workshop, anytime we can do, we will join hands. As such, we have been always working together with Jamia Amdad, and let us work some joint projects also, and all supports from our side. And very important thing that credit course for alternate to animal experiments. Maybe our colleagues, Dr. Rajni Mathur and others who are sitting, we just take it and let us see if we can incorporate that along with the credits for the starting from the final year itself. That is what is there. And I'm delighted that actually normally people write international conference and there are hardly any international delegates. This is the conference, they are not writing anything international, but it is truly international with the delegates and speakers, both from UK, Japan, UK, USA, Europe, South Korea, Belgium, and I don't know, there are many more which appear to be from the list because many are presenting posters and there may not be the speakers. So it is truly, we are honored to have this. I am really thankful for that. Now, when Dr. Patel told that the theme of the conference is organ on chip technology, honestly, in my life, I never worked on that. So it took me a little time to understand properly, but honestly, I could understand little faster because about 2 months back on the call of Dr. Sopti and Dr. Geeta Agrawal, we prepared one book chapter on the organ on chip. So that's why I could recollect. And it is all thanks to Dr. Geeta Agrawal who did it. She was involved in the depth. And of course, I had little background to reach that level. Well, COVID has made many changes and bioevolution is one of them. So biorevolution, biomolecules, biosystems, biocomputing. Now all these are away from the animal experimentation, let me tell you. These are the real changes which have occurred for last many years. And there are many things which are changing, but I will restrict to this top biopharma evolution which has come. Well, I'm a pharmacologist, so I may start with this, but pharmacologists are like a biological scientist only. It has changed dramatically. The knowledge, the way in which things have got, like genetics and all, they have entered into it. The boundaries of integrative, they are all fading. They are all integrative medicine. Many things have happened, and the academics has also changed, fast saying the changes. And one more change which has come after COVID is the online classes. Many challenges, many advantages, many disadvantages. I'm going to see that we are all going to watch that. Teaching, administration, everything has changed with the COVID also. Academics is changing, but many things more than that. Even the professionalism may change now with the COVID. I mean, I am seeing these changes which occurred in all pharmacology for last 40, 50 years. So, tools are also changing. Now, everything, initially all videotape and all that, but now it is all cell phone. There are technologies on the cell phone, and now what we are talking is organ on chip. So maybe doctors are looking to have diagnostics with the like person, telemedicine, what we are talking. On cell phone, there will be one connection. He will give his ECG, EEG, anything. I don't know what is going to be the next change, but it looks that this is the organ on chip. Maybe that online classes, one, now we are thinking online experimentation, simulations, maybe online research also. With the cell phone or the computer, you will be attaching some organ, and maybe you may start playing to get the drugs also. It's not illusion, it may be a reality also. It looks like that. So this is what is changing. Now, since my task has been made a little easier by Dr. Raisuddin-ji, he has already talked all. I will not go, we all know that how animals have been used from years. I will not go into detail. But success stories have been there. Polio research, cat, dog, we know all what has come out of the research. Even the Covaxin and Covishield, it was possible because we had monkeys. And ICMR could connect very well there, and we could get. It's not that we cannot undermine all this. Right? It's a truth. But just like human welfare, animal welfare started. Going back to 1641, the first legislation, I will not go into again all these details, as rightly pointed out, that we are not for that. We are all animal lovers. That's why these welfare things started coming. And in India, I remember when the CPCA was introduced. I still remember the meeting in Delhi with Maneka Gandhiji and Honorable Minister. And I suggested rather that why don't you include pharmacologists and all that in the team? Don't go by only the social workers or like that. She immediately pointed out and noted, and it was executed. I think within a month, everything was executed. This is what I remember. Well, now we all know that nobody can do any experiment without IAEC approval. And you are supposed to see many things. The committee is supposed to see all this. I will take few minutes only to address this, not too much. Like all first three, I'm just combining housing, food, and disposing of. The good thing is that yes, there is a proper pharmacology or biological experiments all throughout. Good housekeeping, good food, this things have drastically changed. If I remember 25 years back or before that CPCA regulation was there, but this was there. But still there are certain bad things going on. There was pressure, but now that also has eased to a great extent. Now the post has also been created. This is the older slide. At that time I used to suggest that no, there has to be a regular appointment. See, many times when you are in the administrative position, it is not that easy to convince everything. But if you have the regulation, it is there. Now in our university also, I could convince him, no, you have to have it. Veterinary regular position. And it is done. So this is one thing. But again, still I think one more thing is missing. The post for animal attendant and all are also supposed to be regular position. I request that yes, it can be taken up. Anyway, use satisfied, I think, with the forms one, form A, form B, everything is getting very well. Few experiments have gone, good things have happened. There was unnecessary use of this in the higher secondary of the frogs and all that. Good. Pharmacy, PCI, Pharmacy Council of India, Medical Council of India, they have restricted these uses. They are not required in simulation. And we are very proud that Dr. Chandragowda Patil is one of the one who has brought out the simulation program, and all the pharmacy institutions are using it. Well, I miss my dog experiment, honestly, even today, because I had 2-3 wonder drugs because of the dog experiments. But anyway, forget about it. But ugly things, there are still there are many things which need debate. I will not go into detail of that. But 3 R's are very important. Replacement, refinement, we are going to. So replacement, the good, bad, again, that yes, human approach has come, biotechnological experiments have come, good thing, everything has happened good. Little bad is that when we ask PG student to do this experiment, it is not. They say no, only for research. So we have a little tougher time in that. I personally feel pharmacology cannot be learned if you don't do experiment in PG. This is what is there. There should be a clear done. And somehow, maybe, I don't know whether it's a pressure of the private institutions or that. PCI also says, okay, not required. I think that is something to be taken care of. And everything cannot be replaced, let me tell you. There is some limitation and it has to be taught. Refinement, for sure, very good thing. Everything is remain the same. But when PG students are not learning, I feel very bad, I can say. I don't say that you have to use large animals, but at least on the small animals. And of course, I was very happy in one of the institutes I saw. They were using chickilium and all that, and they were showing. This is exporting. I really like it. And our animal, we are also trying to have all this. But yes, unnecessary research on the oxidative stress and all should also be avoided. Anyway, I will not like to go into that part. Reduction has been possible. Surgeries and all, now it is all taken care of. I will not go into those things. Now, straightway, I'm coming to the point of the drug discovery, because ultimately, we as the academician or industry, R&Ds may say, you have hampered our drug discovery. So I would like to comment on that. Now yes, there are certain facts that 70 to 80% animals were used to just characterize the promising candidate. All these data, I will not go into detail, but one point only I would like to tell, which is still prevailing, and I personally feel it has to be attended by the PG students or those who are doing the research on herbal or new compounds. Let us first see LD50. What do you mean by that? First see efficacy. If it is efficacious, then only go for toxicity. First they will see toxicity and then going for efficacy. So out of 10, we all know out of 100 compounds, only 5 are going to be effective. So unnecessarily you have killed the 95 for the sake of the useless 95 one. That has to be taken care. It should be strict. I am happy, I think, that in NMIMS I stopped that. I said, no, it is not required. Only if you find effective, then only go for LD50 or any toxicity test. I made it enough. So this fact has to be understood. This is one thing. So this is, a greater chunk of unnecessary things are going on. That's why I'm trying to mention at this platform. Now, science of science has come in the COVID era. I will not go again into detail because of the time. Let me come to the important part, the theme of the society itself. Alternatives to be developed for after these regulations. Many alternatives of physico-chemical methods were tried. Okay, there are limitations, but in vitro became most common. Whether any management or likes or not, they have to be there. Whether it is an expensive or whatever it may be, but cell culture is one of the easier and the best way of doing it. Microbial assays, microdosing, stem cell therapy, and computer-based. All these things have come. Now, computer-based is, I will say it is first because the new drug discovery has to start from if it is a chemical, the docking study. And we have it. We could get the COVID drug only and only with the starting of the docking study. And that person or Dr. Kalicharan was doing at home and did it. We got it. We did not even extract the things. Straight from the whatever compounds are available, we went on it. And we could find which are the right plants. So this is the way you can minimize it. And it is going on. And very important thing, of course, it is missing in this slide is the use of aquatic animals. I mean, we all know, and 2 workshops are going to be held, right? Sea elegance and all. This is very, very, very important. This concept is yet to come. I'm happy that this is like there is was one I had just forgotten that for the Parkinsonism also this model was used. It's beautiful. This is also, it has to be compulsorily added into the curriculum. There is no question. I think we can have it in our syllabus because at least add-on we can do. This is very, very important. Now we are coming to that theme of what we have talked. See, there has been change in the medical science, medical practice from all angles. Whether it is a herbal, source of the drugs, we think of now gene therapy and all that. We are happy that in this conference we are going to have that. Diagnostics. When I used to talk before COVID about diagnostic, people were not believing even. Now even an ordinary person understands there is something like RT-PCR. This is the sea change which has occurred. So at this stage, if we don't understand, that means there is no words now. Whole world is now looking. Previously, European and sub countries, they used to feel that why should we bother about the communicable diseases? Now the world has come together for this. This is what the big change which has occurred. Similar changes have occurred, but this era beyond 2020 is going to be post-COVID era. It will be known by post-COVID era now. You say biotechnology era, patient care era in pharmacy, but it is going to be a post-COVID era in, I think, practically all allied health sciences to me. Well, as a pharmacologist, I'm sure our Dr. Vaikulka will very well remember. We used to talk up to 2000, the genetic revolution. Trends in pharmacological sciences. The article came up. But now it has added to omics revolution, proteomics, metabolomics, transcriptomics, and all that. And as I feel that there will be a separate post-COVID revolution, which is yet to be seen. Well, coming back to all this, I want to attend to this DNA chips. As such, in this 2021, in this 21 years itself, we have seen many changes which have come. To me, all are revolutions. genome project to gene therapy to precision medicine to biomarker. You can go on naming. I could sort out 21 revolutions which have occurred already. The change started with the DNA. We all know that when the human genome project got completed, we thought there will be a lot of druggable things, but what it gave was the diagnostics simultaneously. And the whole method, the strategy change for the drug discovery. So what I am talking that I missed the dog experiment, truly I am not missing also now, because now I have to understand the structure first and then go for things. Previously, I was getting from the animal and then go back to that. It is reversed totally now. And at every stage, you will find something like biotechnology or gene-based things involved. That is what I don't, again, because of time, I cannot go on talking this. But one thing which good thing has happened is that genome, which was highly expensive, I mean, $1 million suite has come down to thousands only. That is what has happened. Whole picture has changed that I told that we have to start with the molecular, the bioinformatics or the talking study and then go further. Start understanding the structure of the target. Well, all these things have emerged. We all know this, whether it is a stem cell therapy, gene therapy, or whatever it may be. Even the CRISPR technology, gene manipulation directly. Gene, there is, I think, there are experts who are going to speak on the regenerative therapy also. Omics, initially I was not ready to believe that the genomics, there will be something further than genomics. Now it is omics, and the figures showed that no, I have to learn this metabolomics also properly. But I don't think at this age I can start doing this. Anyway, but just to tell that yes, don't underestimate, it is going to be the future. By the time you will be expert in genomics, probably you will be outdated. It may happen, even in 10 years. And the data has started coming, how metabolomics can play an important role in drug discovery. Well, we got it. Now, why I want to show, not to show that we have done it, but our approach was first to have bioinformatics. I took two types of reverse pharmacology. One by Dr. Ashok Vaid and Bhushan Patwardhan, Dr. Professor Bhushan. Another side, what was published on the other side, that how bioinformatics to all. So here we went to that through the molecular docking. We identified, based on literature, we said that ACE2 is the best target, and phytoconstituents already established were docked. System was understood, formulation was made, antiviral study was done. Of course, University of Missouri helped in that. And finally, we got into the clinical trial completed and the drug is there. Well, it is possible. I mean, hardly one set. Now, whatever animal experiments are going, it is further to it. Even why I brought this slide, because pharmacy, everybody is working on nanomedicine. How many are thinking that it can be useful in the CRISPR and the gene DNA understanding also? One has to think that also. Repurposing of drug. COVID has given that very rigorously. And final, I am not the expert, but whatever I could understand, it all started with in vitro models first. From there, the 3D printing in what in vitro model, or what we say bioprinting, would be established. And there, the 3D bioprinting mimicking actual arrangement in the tissue, that was the case. And then based on that, the mechanisms could be established. And now we have something, the organ on chip, which can be used for not only the understanding the disease profile or therapeutics, but also for drug-drug interaction, and also a platform for the personalized medicine. The precision medicine, what we are talking, which is going to be the future. This is the organ on chip 3D printing model. as I could understand. What I could understand is that the process involves not only your biology, but biophysics and all that. The knowledge about the polymers to all that. Physics, biology, and math all have to come together. And the whole process can be seen. It can be described. I think there is one there is a speaker, Dr. Mohanam. He is going to describe. Please attend that. This is very beautiful, wonderful. What I have understood is that as of now, within short time, this thing has already come. Organ on chip, the gut, pancreas, kidney, they have already come as the organ on chip. And you understand what liver means. If liver is there or kidney is there, that means PKPD department the load has to go down. So this is what is the case, pharmacokinetics. So this is what has come. And again, there are different models, and this will be something useful even for the precision medicine. It is going to be the future. So this is the organ on chip model which we are talking about. Well, definitely it is the potential to substitute animal models. And the figures are again very overwhelming. CAGR of 63%. I cannot believe. I don't know. I hope that this data is correct. And it is going to be 5 million. I mean, fast it is established. It's a very newest field, I can say. And it is fueled by personalized medicine. Because of this personalized medicine, the growth rate may remain even high. There are many players already coming. So, I mean, from 5 million to it may jump to 303 million. So, anybody who's thinking of innovation, the startup, this is the area. And already there are many players started coming in. That's what I found. I'm sure that this Society for Alternative to Animal Experimentation will make a big dent by working in this field. This may be a conference which will help it. So thank you very much. Be little different. Thank you so much for giving us.
Thank you, sir. We feel privileged to have Dr. Y.K. Gupta, President SAAE-INDIA, as a chief guest among us. May I take the pleasure of requesting sir for the presidential address. Sir, please unmute yourself.
Thank you very much for organizing this wonderful event and inviting me. And I would say a great thank you to my very good, very old friend, Dr. Ramesh Goyal, the Honorable Vice Chancellor of this prestigious university. And I was really impressed by his talk and by his dedication, and the entire team of DIPSARU for organizing this conference and also pre-conference workshop which they have been doing. And also my thanks to Dr. Patil and Dr. Anup and many others. I'm not going to name, but I can see Dr. Harvinder Popli and Dr. Sahu and many others, Dean of the university, to make this event a success. And I also thanks to Ankita Pandey, who is the policy advisor, director of PETA, for being with us, with this society right from inception and promoting the cause of our society. And I also thank Dr. I not thank, but I think I should not thank Dr. Akbar because he is the creator of this society. And we all are very indebted to Dr. Akbar Shah, who conceptualized that we should have a society of this type to promote the science of alternate to animal experimentation. And 4 years back, he thought that we should make a society, and we made it. And now rest is entire a success story. Never I've seen a society with such a growth in terms of a membership, in terms of a widening the activity, and in terms of a being recognized by the scientists and by the government and by policymakers. So thank you very much. And I will say a big applause to Dr. Akbar Shah. So Dr. Akbar Shah, thank you very much. And I see my another extreme friend, Dr. Raisuddin Saab, who is the vice president of this, and he has been right from the beginning in identifying, and we had a series of meetings in his office, in his place, to decide how to work and how to take this forward, this society. And also Dr. Vijaypal, Dr. Mohanan, Dr. Rohit Seth, and so many others. And also my international colleagues, who not only provided the technical support, but also the support in mobilizing the international community and knitting this society in a much, much more powerful manner. This is our 4th meeting. And in the first meeting, it was a grand success. The second meeting, I do not know how to increase the vocabulary, to increase the grand and the grandeur and the grandest success today. What we are having is the international meeting where more than 1,400, more than 1,500 participants are connected. So great clap and great appreciation to the entire team of this. So thank you very much. Now, to say what already has been said by so many speakers, without doubling, I have just to take off my presentation because of it would have been almost a duplication for that. If you just understand, are we here to say that no, animal experimentation are rubbish? The only answer is in vitro, in cell, or chips? Perhaps no. That's not the purpose of this society. Purpose of this society is, can we use alternate method and reduce as much as possible animal experimentation without compromising science, without compromising the safety, without compromising the evaluation of efficacy. The science is a dynamic process. There was a science in long back, maybe 1,000 years ago, from the time of Shushruta, from the time of all those days, where experience was the most important evidence. You see how the system works. There is, and first there is, if I just say there is an intuition first, yeah, this is the herb, it may work. And then there is a perception. That means I have seen that some few people have taken it, and some of them, they got relief from the pain, or they got relief from anxiety. And my perception is that if a cat crosses 10 times, this will create harm. Perception. But then gradually it becomes experience. And when I say experience, means out of 10 times, 6 times it worked good, 4 times it did not work. And this experience you increase by doing evidence-based research component or evidence-based research by appropriate number, appropriate methodology, and then you come to the evidence, and then you evidence-based medicine. In this entire process, the time taken to reach from intuition to perception to experience to evidence and maturity of evidence with the caveats, it is a long process. So what we did, we want to have more surety, more clarity, and therefore we started doing experimentation on animals, because that will provide you some similarity of genetic similarity in human analogy as much as possible, 40% to 90% human analogy, and therefore we started working on animals. The nearest animal was monkey, dog, cat. So we started working on that. But when you say rightfully, it is not permanent right. It is to be temporally correct. It has to be contemporary. So what Dr. Goel said, that when we were doing our MD, we used to run after dog, catch them, do the experiment and find the evidence. But then I was very happy. But then gradually, everybody thought, can this dog be replaced by some lower animals? So we started finding whether the rat and cat can give the same effect on the blood pressure, antihypertensive drug. Can this rat and cat be better model for doing anti-psychiatric or psychotic drug analysis? And we found that yes, there is a simulated method, better method. And therefore there is no need to sacrifice the dog, cat, pig. But then there was some caveats. And then we also gradually science evolved. And then when the science evolved, and then we found, there is less need of cat, rat, because we can do the same evidence generation by doing the experiment in Drosophila and C. elegans. Now zebrafish. Now zebrafish is being used by including small labs, including small academic institutions, which can predict not only the efficacy, not only the toxicity of, almost rather say, it can predict almost every model can be developed with that. Starting from pain, starting from anxiety, starting from antihypertensive, mutagenicity, tox. There are increasing number of models which we people are validating, developing, validating in zebrafish, including the small or so-called peripheral institution. And I have been seeing this institution, a pharmacy institution across the country, including the institution where I visit sometimes, the ISF College Moga. People have, there is this wonderful developed zebrafish lab, and compared to the very, very high-tech developed zebrafish lab in ILS, or maybe the Institute of Life Sciences, the Reddy's Institute of Life Sciences in Hyderabad, or in IICT, or maybe IICT Hyderabad, and also at a couple of other institutions. Drosophila is an animal, is not an animal, is an insect, which can predict not only the neuron-based toxicity, efficacy, but also several toxicity because of pesticide and environmental toxins. Now, this has also been used as a genetic modified Drosophila, C. elegans. Now, the important thing is, there are 2-3 important things. And then we also, we means, when I say we means the scientific community working on drug development process toxicology, started working on, can the same enzymatic system, can the same dynamics, can the same kinetics be reflected in a computer simulation model? And that is nothing but what you call as a chip, organ on chip. And it was found, yes, it is possible. It is possible that you develop a simulation and what is put into the chip, the entire program, and then you virtually inject a drug and see the effect, which will be reflection what is happening on the human being. And you incorporate number of enzymatic alternate mechanism. You also incorporate the number of variables which can be there because of physiological, because of pathological changes which can happen. And then you develop, is almost, not 100%, like an organ. Making organ on chip is a complex process. You have to make a cell which is in identity itself. Then making a cell in a very systematic joint, it becomes an organ. And then this organ has to connect with many organs to give it a compounded picture of a drug or of a response of a diet, food, drug, or environment. Now, if I say If I want to test a blood pressure changing effect of a drug, a new drug, can I use a cell line? Perhaps no, because it will give effect on the cell, but it can give what the mortality, what the toxicity of the cell is. Can I do this in a rat alone? Perhaps yes, but perhaps no, because it may not reflect 100% what is going to happen in human being. But then, can a clinical trial reflect? Perhaps yes, but perhaps partly no, because it may be different response in some of the individual, and that's why there is a pharmacovigilance or the PSUR or PMS studies. So this is a process. We are now working on where and how much and to what extent alternate to animal experimentation can be initiated, primarily because we want to be reducing the burden on animal, ethically more correct, mentally we are satisfied that we are not harming unnecessarily, but and yet satisfying the evidence needed for the science. And that is the development of alternative to animal experimentation. What is most important thing is, a lab is working on animal experimentation, alternate animal experimentation, maybe zebrafish, maybe Drosophila, maybe C. elegans, or maybe microbiological assay, or maybe organ and chips in one institution. The other institution does not know what he is working, and therefore he continues to work on a different model, and the third person publishes the third model. The better strategy, which I would say, that these A institution, B institution, and C investigator, they join hand. That is the purpose of the society, and understand each other, validate a model, crystallize this model methodology, validate model, mature this model, and make this as an alternate. A publication doesn't make an alternate model. Publication will make only a suggestion. Validation will make perhaps a model, suggested model, but incorporation of this model into the regulatory system, into acceptable evidence, will make it an alternate model. So when our objective is Society for Alternate to Animal Experimentation is not only to publish work, is not only to work on this, but to join hands, consolidate results, make a big case, and submit it for regulatory agency. And this regulatory agency is then based on the evidence which we have generated, will put this as an acceptable regulatory issue. That was our objective. I have seen and couple of forums, whether it's the DBT, ICMR, people asking for fund for organ on chip projects. IIT Delhi, IIT Madras, and many other academic institutions are working on organ and chips. IITs are working on organ and chips. Imagine, because they have inclination of technology. But then biologists, toxicologists must chip in as an equal stakeholder in that. And then give a validation. Validation cannot come from an IIT alone. Validation has to come from biologists, ICB or maybe IISC or maybe College of Pharmacy or maybe like that. They have to work in combination with the computational science and with the chemistry, or maybe the biotechnologists or the data analytics to work on this. And recently, I have visited one of the GLP laboratory. They are working on organ and chips, developing skin and artificial skin, but incidentally, they were not aware of how many institutions in India are working on organ and chips, particularly developing artificial skin. That was an unfortunate thing. Because if there is a CLRI, Central Leather Institute is working, even the Institute of Moga is working, in the institute, there are 5-6 institutions working on wound healing institutions, like wound healing property of on the isolated skin, organ and chips. There are some institutions working on dialyzing membrane and making as artificial kidney. to look for what can be the hemodialyzing fluid, which is better, but in a disjointed, in silo activity. What is required today is that through this type of mechanism, through this society, we spread this news, we spread this information across our member. You see, this is the wonderful activities which is being done by Dr. Akbar Shah's lab. This is the activity profile which is done by DIPSARU. This is the activity lab which is done by IIT Delhi, Madras, and this is the platform which we have created where there is the international support also. I was just talking to, I think there was a meeting with FX0 committee just 2-3 days back where Dr. Akbar Shah was on VC, I was on VC, Dr. Raisuddin and Dr. Patil. The international companies are interested as a partner to give of technical support, and they also see that India is a big business partner, not because they want to make money, but they want to see what is the academic exchange possibility here. Huge. So finally, I would say 3D printing, whether you call as a 3D printing, whether you call as a organ on chip, whether you call as a new culture, new culture methods, there is a tremendous possibility where we can develop more and more method. The objective should be develop a method, validate it, publish it or patent it, and then use or influence many others to adopt that and then approach the regulator, or that should be the science. Who will fund it? Funding of these is a difficult thing, but the government of India is welcoming this, including ICMR and DBT is welcoming to have projects, and if there are projects which are collaborative projects, it will fund better. We are also looking the exploratory possibility or exploratory efforts if industry which are requiring an toxicological study and finding it difficult to use animals and larger animals, they should fund it, the research projects, because ultimately if in vitro or in silico or any experimental or alternate animals becomes a regulatory acceptable thing, it will be easy for them. So putting money into an expected science or anticipated science benefit is a wise decision. Investment, the return of investment is always a concern, is always one of the criteria for industry. But our responsibility is to tell them what is the return of investment. What you are investing today will be your return tomorrow, and through science. That is what is, I think. And we have so many laboratories, more than 50 laboratories now, 50 laboratories of GLP compliant, and many of them are working on isolated or maybe on alternate to animal experimentation. We should knit them, make them members, take them on board and work in uniformity. Finally, I would say our society SAAE, I would say this is, people should not just remember this is SAAE-INDIA, may not be remembering what is the full form. So must remember what is the full form of SAAE-INDIA. Otherwise, it will become an acronym. Must remember what is the philosophy. We are not fighting with those groups which say, including me, which say the animal experimentation is a must. I am not saying that without animal experimentation, nothing can happen, but it can be minimized. It can be rationalized using R principle. I am saying extending this R, 3R was the initial. When you say reduce, now there are multiple R's. Reduce, refine, replace, rehabilitate, regulate, and then use them. So using this R principle, bringing these alternate models to the regulatory requirement, making a unified attempt is our objective. So again, I congratulate my fellow colleagues here for making this society very strong and this conference very successful. And again, my thanks to my friend Dr. Akbar Shah and Dr. Raisuddin and all others. Thank you very much. Namaskar.
Thank you, sir. May I request Professor C.R. Patil, Organizing Secretary.
Thanks a lot, Dr. Y.K. Gupta, sir, for joining us. Actually, we are running short of time. It's already we are 5 minutes late to start the next session. So the conclusion of this inauguration, I'm just doing by saying thanks to all from the side of DIPSA and from the side of SAAE-INDIA. Whoever is involved in the propagation of these 3 Rs, I'm thankful to them, and I'm thankful to everyone for being with us here. With this short delivery of vote of thanks, I'll request the next speaker to start his session, because we're having 2 foreign resource persons waiting for their lectures after his lecture. So thank you, everyone. And I now request Dr. Vijaypal Singh, sir, to start the next session.
Yeah. Hello, everyone. Good afternoon. I hope you can hear me.
Yes, sir, we can hear you.
Yes, Dr. Vijaypal, we can hear you.
Yeah, thank you very much for Professor R.K. Goel, Professor Raisuddin, and Professor Akbar Shah for this wonderful event, and also Dr. C.R. Patil for organizing this wonderful conference. And to further this, I would like to quote the thing what is being said by Dr. Y.K. Gupta and also Dr. Ankita Pandey, that we should rationalize using of the animal. And recent example you might have seen, the earlier the time taken for development of vaccine used to be 100, and now the same vaccine is being developed within a year. And also in that one, you need to rationalize which is the model that we need to use. We cannot test this kind of thing on every animal that is available. So this rationalization is very, very important. And such is the topic, which is the next topic, stem cell and regenerative medicine. That is the translational approach. Very fantastic upcoming field, and also equally exciting and energetic Professor Dr. A.B. Pant. And I have the privilege to introduce Professor Pant. He is an alumni of Department of Biotechnology, IIT Roorkee, Uttarakhand. He started his career over 30 years back at CSR Central Drug Research Institute, Lucknow, and presently serving as a senior principal scientist at IITR, that is Indian Institute of Toxicology Research, a lab of CSIR. He is also Professor of Academy of Scientific and Innovative Research, institution of national importance set up by the Act of Parliament. Professor Pant's elegant research offer a much sought framework for understanding neurodegenerative disorder, potential therapeutic intervention, and a strong base for interpreting the human brain specific neurotoxicity and development neurotoxicity. His strategic international collaboration with the University of Sao Paulo, Brazil, has developed a strong roadmap for effective drug development and therapeutic interventions in amyotrophic lateral sclerosis, a fatal neurodegenerative disorder. Being a nodal scientist, Dr. Pant coordinated the entire COVID-related activities, including the real-time PCR-based testing. SARS-CoV coordinated the entire COVID-related activities, and also the genome sequencing, seroprevalence, and capacity building of IITR. Dr. Pant is also instrumental in establishing the Africa Center for Excellence in Material Product Development and Nanotechnology at Makerere and University, Uganda. He also dedicated himself to fostering the contemporary science to postgraduate PhD student researcher and university teacher. He is also lead inspector for the Government of India and also serve as expert for regulatory bodies such as BIS, CDSCO, NABL, FSSAI, NGCMA, ICMR, and DST. And I would like to add here that with Dr. A.B. Pant and Dr. Y.K. Gupta could come up with a regulation on antibiotic that is to be used in food producing animal, and that is also being implemented. So With this, he has so many big data. I don't want to take much time and I don't want him to keep waiting. He is currently being the chairman and also member of several national and international committee, board of government, institutes and body, and he also serves as a member of editorial board of several reputable journals. So my personal edition, he is very energetic, very clear thought process person, and also we work together on a WHO related project on situational analysis of chemical contaminant in food. Over to you, Dr. A.B. Pant.
Thank you, Dr. Vijaypal Singh. And I would request the organizers to please allow me to share the screen because it is showing that host disabled participant screen sharing. So please just allow me to share the slides. That will be happen from the organizers part. By that time they are just allowing me, I will say that at the outset, let me express my thanks to the organizers for providing me this opportunity to share a few of the aspects of the stem cell research or the in vitro alternative system, what is going on in the country. And still I'm not able to share because that rights are not given to me. So I will request the organizers, please allow me to share this because this message is coming that host disabled participant screen sharing. I'm audible to that side?
Yes, sir, you are audible. They are, I think, perhaps working.
Yeah, but still I'm not able to share the screen. Anyway.
Now you can share your screen.
Okay, yes, now it is.
Okay. Yes, sir, it is visible now.
Yeah, it is in presentation mode now?
Yes,
yeah. Okay. So thank you so much. Initially, my title of the talk was different, but when I just look at the program, then I found that my next speaker, Dr. Francisco, is speaking on the 3 R's in EU policy. Then I thought that I should also just talk something about that, what the Indian perspective and what the progress made in India regarding the 3 R's regulation and all this. So based on that, I have just kept my talk in that direction only. So in the initial few slides, I will just give you the glimpses that what kind of progress India has made regarding the development of new alternatives. And then in the second part of my talk, I will just show that what the progress I have made regarding with using stem cells and the induced pluripotent stem cells. So if you see that why and how India has made this progress regarding these alternatives, if you see that just a couple of decades back, there was a lot of pressure from the ethical angles, political and regulatory and animal welfare societies, and with the development of technologies and advancements, that these 3 R's converted into many R's, as my mentor Professor Y.K. Gupta just mentioned few minutes back, that now instead of 3 R's, there are many R's, while that reducing the costs. When we are using the alternative system or in vitro system, that the drastic reduce in the cost is there, because that using animal system, we need a huge amount of infrastructure and resources that can be reduced, and the reproducibility of the data is very well there, because everything we are doing in the control conditions, because that we are using incubators in the temperature, humidity control, media control, and everything, and protocols control, so that reproducibility can be achieved very high level, rapidity, relevance, and rehabilitation, and overall to that responsibility. Responsibility means that at least we should think twice prior to use the animal, that the all organs, because that what the scientists can do while we are planning any experiment, so we can sit together beforehand and decide that, because maybe that in my experiment I need only brain, so that means somebody else is required the kidney, liver, lung, and other organs. So that means the maximum utilization of the organs should be there. And if we just keep all these R's together and do the plan experiment accordingly, so that means definitely we will reach to some alternative model, but that not the cost to the human safety. Now we can say that in what way India has made the initiatives, then in April 2011, India became the signatory country for the mutual acceptance of data in OECD. What it means? It means that if in any of the GLP certified laboratory, the data for the safety, preclinical data for the safety of any compound is generated, that will be accepted as such in the 38 member countries and more than 50 countries which are associated to this OECD. So that means data is accepted as such more than 90 countries and no need to repeat the experiment on that. So by doing this, we have just cut down the number of animals drastically and significantly. Subsequently, in January 2019, as Dr. Akbar Shah narrated in the beginning, that the Society of Alternatives to Animal Experiment was launched, and with the aim to promote the adoption of alternatives to animal in experiments and campaign the 3 R's in the India. That what the strategies in India we had initiated 20 years back, initially at IITR, Lucknow, later on in the part of country, that first, because that first need was to establish those models which have already been approved by the regulatory agencies like OECD, ICH, FDA, European Union, IMA, and other things. Because that time, even the models are not available in the country for the regulatory studies. So in one hand, what we are doing, we are establishing the already developed model for the regulatory studies. And at the same time, what we are doing the investigative research to develop new and more sensitive alternative system for the experimentation. And the ultimate target is that whatsoever new models we are developing and what the models we are establishing, that those all models will be used or currently being used for the GLP compliance, non-clinical safety and toxicity studies and efficacy studies for the regulatory submissions. And beside that, other strategy would be that to develop a national SOP for animal experimentation at various level of education and research. Because if you see that across the country, if you see that the different kind of syllabuses and different kind of experimentation with the animals were used initially, then in 2012, that the UGC has completely banned the animal experimentation in the undergraduate and graduate studies in the basic sciences. And even in the pharmacy and the medical education up to the graduation level, the animal studies are only at demonstration level using 1 or 2 animals. And in the post-graduation level and the research level, stringent CPCSEA guidelines are there prior to use any animal experimentation. And now we are in the process to develop a harmonized SOP which will be used across the country for all kind of educational and research organization. I have put a few of the examples where we have adopted the developed model which are already there in the regulatory system but not established earlier in the country, so that we have established those models at our organization, as well as we have provided the trainings to the other organization to establish these models at their place. Say for example, the cytotoxicity assay for the biomedical devices, that simple, this ISO 10993-5 and US Pharmacopoeia simply say for the endotoxin detection. Earlier there was a rabbit ileal loop assay where at least 5 rabbits were required just to see whether that product is having any endotoxin or not. But later on, it has come down to the one that in vitro assay, which is called as LAL assay, Lamulus amoebocyte lysate assay. This is a simple in vitro assay where you have to take 1 ml of lysate and 1 ml of your test item, mix it and just leave it at room temperature for 20 minutes. If a gel is formed, so that means that your product is positive for endotoxin. If gel is not casted, so that means product is negative for this LAL assay. Further, we have miniaturized this assay at our place using only 50 microliter of test item and 50 microliter of LAL reagent. So again, this miniaturized test is already been patented at IITR and now is being used by the various persons in the different industries. Besides that, L929 is a cell line which is approved in the all regulatory system for the cytotoxicity assay for the any biomedical products. Similar way that ocular irritancy testing, epi-ocular system is a totally 3D made corneal model consisting of normal human-derived epidermal keratinocytes, which have been cultured to form a stratified squamous epithelium similar to that found in the cornea. And that when we just do the experiment, then we found that yes, the pro-inflammatory cytokine response is at par what we were getting in the eyes of rabbit cornea. So that means now this rabbit cornea assay for the safety and toxicity study is almost eradicated, and in a committee where Professor Y.K. Gupta was chairman, it is recommended that this assay is totally replaced by the epi-ocular assay. And the epidermal skin cytotoxicity model, it is again a model, 3D model, using the normal human-derived epidermal keratinocytes. And this model has been used to validate for this cytotoxicity assay, irritancy, as well as the cytokine profiling. And the results are at par what we were getting with the help of the rabbit model. So that means this model is also being used in the regulatory system and almost approved in India itself. Besides that, in IITR, Lucknow, we are using that the regulatory ecotoxicology in aquatic system. And if you see that algae, Daphnia, zebrafish, and this other kind of fishes, and the all sort of models which are accepted in the regulatory system, those are all established here and currently being used for the purpose of regulatory studies using for the non-target toxicant or environmental pollutant. So that means if you see that these 200 series of OECD has already been approved and established at IITR. And this in case of terrestrial ecotox studies, earthworm, honeybee, Japanese quails, which are already approved models for the ecotoxicology studies, those are all established here and currently being used in the GLP studies at IITR. Similarly, if you see that all short of what the models for short-term studies and long-term studies approved by the OECD and other regulatory agencies, those are just established at IITR and we are currently using them. Recently, OECD just approved one guideline using this gill cell line for this primary screening of the environmental toxicants or any xenobiotic which may be a non-target species toxicant using this. And this model has also been established at IITR, where the simple test is that you can use simple dose cells into the culture plates and in a rapid high throughput manner, within 24 hours, you can get the primary screening or maybe hundreds of compounds. So in a first year of screening, you can get an idea that yes, using this gill cell line system and a very, you can say that very established method they have used with one dye, that the mitochondrial activity, lysosomal activity, and the membrane integrity. These are very simple tests, but they are very robust tests for this primary screening of any test item or any toxicant to say whether we should go further with this compound for the development of a product or any drug or not. So that means this is already established at IITR. So that means these are the other ecological models which are already there, which are already approved model and established in our country at IITR and other places. We are just giving the training to them. Now come to this, that beside this, say, as Professor Goel mentioned that in the drug development now, that computer play a very important role. So if you see that now the drug development process is entirely different process, because even prior to synthesize a drug molecules, what we are doing, we are simply designing a molecule of drug candidate and putting them into the database software, and that database software will tell us whether this molecule is already existed as a drug or not. If not, then what will be the biological interaction of this molecule with the system, what is the pharmacodynamics, pharmacokinetics, and other kind of toxicity and all this. once we found that yes, this compound is having more efficacy and less toxicity in the biological system than the existing one, then only we will synthesize them in a milligrams and micrograms, and then those molecules will go with the first year of screening using the 2D culture of primary cells or the immortalized cell line from the human subject and the 3D organoid culture. In later part of my presentation, I will show few of the slides where we are using these organoid cultures in my laboratory, and compound passing through these cultures. And one step ahead to that, what we are doing at our laboratory, that instead of using the cells from the animal sources or immortalized cancer cells, we are using stem cells. We are taking a stem cell from the healthy individuals, and those cells are converted into the desired kind of cells under the specific growth stimulus. And say, for example, if we are taking a hematopoietic stem cells, we are converting those hematopoietic stem cells into the neuronal cells, into the glial cells, or into the other kind of cells where we are testing the drugs or chemicals which are directed against those organs or those cells. So that means what the response we are getting in the primary screening that are just mimicking to the human subjects, and the failure at later stage can be minimized by using that. So that means the molecule showing positivity or the efficacy and the less toxicity at this stage will go to the alternative models like the algae, Daphnia, Drosophila, and this zebrafish, C. elegans, and earthworm. And the compound just pass through these models only will go to the rodent system. So these are entire list of organisms are with that IITR under GLP gamete, and that we are doing these screening in a that tier fashion by reducing the number of animals, resources, time, and everything. Beside that, now one model which we have developed. From this point onward, I will just tell you that what the models we have developed by the investigative science, not the establishment. Establishment is first part. Now we were involved in a drug screening program where we were doing the receptor binding assay using the synaptic membrane from the rat brain. So that means for this screening, we used thousands of rats. Later on, we realized that instead of using the synaptic membrane from the rat brain, if we could able to use the membrane isolated from the cell culture. So that means we took the neuronal cells and just made the membrane from that and use a similar pattern for the neurotransmitter receptor analysis. And what we found that the results were at par or rather better than what we were getting from the rat. And now this model in the high throughput system is well established and people are using all across the globe this model. So this model is one among the models which we have developed indigenously at IITR for the high throughput screening for the neurotransmitters for the drug development program. And if you see that other major part of research what we are carrying out in our laboratory is that just I have to give us some little bit introductory part of this, that it is well documented that the developing brain tissues are more vulnerable to the drugs and chemicals at a dose which is usually non-toxic to the adult's brain. And that such toxic exposure during the gestation period and the early stage of life may cause a long-lasting disability. And the unfortunate part was that we were not having any high throughput screening system to see that whether this drug is going to induce any developmental neurotoxicity or not, because the gestation period of human being is a 40 weeks, and that 40 weeks is a long period of time, and it is quite possible that during that period that lady who is in the family way may have some kind of infection of some kind of disease where we have to give a drug which we have no choice to give a drug other than which is known developmental neurotoxicant. So how to screen any of the drugs prior to put them into the market, that whether this drug is going to be a developmental neurotoxic or not. So no models were available. So almost 20 years back, we started this exercise using the hematopoietic stem cell from the cord blood, because cord blood is one among the research sources of the stem cells. and that the cord is a waste material after the birth of a child and we have to throw it. So from a waste material, we just drag out the stem cell and do the characterization, lot of combination, permutation for the growth factors to grow them, to multiply them, to characterize them, then to convert into the neuronal cells and the glial cells. And through all the entire developmental period, we have just assessed that which specific genes are responsible for the developmental neurotoxicity against a chemical insult. So that means we had provided the toxic insult with the known developmental neurotoxicant to all these developing stages of cells. And finally, we could identify the certain number of genes which are the stage specific responsible gene to show that yes, these are the genes which are going up and down regulated significantly against the exposure of any known developmental neurotoxicant and unknown developmental neurotoxicant. So that means we put all those genes on a chip, and then those chips are now being used to assess that the compound which is supposed to be a drug in future is a developmental neurotoxicant or not. So that means this model we have developed, and this model has already been discussed in OECD document in 2018, and it is almost in the words of making a new guideline of OECD for the developmental neurotoxicity evaluation of drugs and chemicals, and probably in a year or so that this guideline will be available from the India first time in the OECD. Then later on we realized that this is the 2D model where we are growing the stem cell derived neuronal cells and glial cells in a purified culture in 2D culture, while our body is a 3D, and whatever response is coming against any compound or drug, that is a 3D response, or maybe many tissues or many organs are working together to metabolize that compound. So that means with this view, we started working to develop the 3D organoid models, and with this thought that first we will screen the compounds at this 2D system, and compound just found positive or showing activity will not go directly to the animals. In between, we will put one step, that is the 3D spheroid model or 3D organoid model. And with this thought, we started working with the human induced pluripotent cells, that is iPSCs, as well as the cord blood stem cells. Both kind of stem cells we took, and we started just making them into the organoids, because developing a complete brain is not possible, because in a human beings, if you see, because of the physiological functionality, we can just say that in brain we have around 52 regions, and those 52 regions are different because of their specific neurotransmitter secretion, and because of those neurotransmitters the specific functions are there. So instead of developing an entire brain, what we are doing, we are developing the organoids of brain specific regions. So initially what we have developed, that is the cholinergic brain organoids, dopaminergic and the GABAergic brain organoids, because those are the regions which are specifically targeted against the environmental chemicals like the organophosphate pesticides. And because in Parkinson disease, the dopaminergic region is grossly affected in nigrostriatal region. So that means dopaminergic organoids and the cholinergic and the GABAergic, 3 organoids we have initially developed. In the last 8-10 years, we have made these efforts. And just in next few slides, I will give you glimpses of that, what kind of organoids we are developing and how we have developed and what the process is. So that means this is this one just picture I have kept just to show you that how these cells are looking in the culture medium when we grow them into from the iPSC. So that means these are the neural progenitor, then this embryonic body, where you see that this is the ectoderm and the mesoderm and the endoderm. The blue part is the endoderm portion, and this green portion is the mesoderm, and the red portion is the ectoderm portion. So that means these are the embryonic bodies and these rosette formation, and finally these are the organoid formation. These are the simple one figure representation, while we have just went through the hundreds of markers and hundreds of combination permutation to just make these kind of changes or these kind of organoids. And then this is one picture where I'm showing that how these ball of meats are looking into the culture medium, and if you see that these are the markers which are just there in the organoids and showing that yes, they are organoids with having the expression of those markers for which we were looking for. And this is one assay in which we have tried to just establish that what the cells we were growing in the culture medium or the organoids what we are growing, whether actually they are having the pluripotency capacity or not, they are having the teratoma formation capacity or not. So that means these immunocompromised mice we have injected, and finally by third month we got that yes, those cells have the teratoma formation capacity. So it shows that what the cells we are growing in the culture medium as a organoid, those were having actual pluripotent stem cells as well as the perfect organoids what we were looking for. One thing is that our brain cells or the neuronal cells, they are basically immortalized cells, because if you see that the rest of the body somatic cells, they are having a fixed lifespan. Maybe what the cells in our skin today is, after 1 month those cells will die and another cells will be there. But what is your age? That is the age of your neurons in the brain. So that means the limited proliferation capacity and the longevity is there, and what the degeneration is there, that is senile degeneration over a period of time. Otherwise that neurons will survive, and that each set of neurons will just store a set of information. Once that set of neuron is damaged, so that means that set of information will be lost. So if you can just recall from that, if suppose that you just meet your any childhood friend after 30-40 years, so you will try to just recollect all the events of your childhood, but maybe certain events you are not able to recall because that set of neuron is already degenerated because of the aging or because of the senile degeneration. So while these neuron cells are not dying over a period of time while rest of the cells are dying, because that our body is not neutral and having an electric current, but what the current is there in rest of the body cells, that is different, and our neuronal cells have a little bit higher amount of electric current. So that means when we are working with the neuronal cells or glial cells, the organoid cells, so might be they are expressing all the markers of the brain, something like, but if they are not having the electric current what is required in the brain, so that means all these experiments are useless. So with this intent, we just went through the experiment by which we can see that whether those kind of current is there in the culture cells or not. And for that, these experiments were carried out, that is the patch clamp assay, and we found that yes, what the amount of current is there in the brain cells in the in vivo system, that the exact current is there in our cultured cell. Now you'll see that peaks will come, and those peaks will show that yes, the amount of current is accurately same what we are having in the brain. So that means what the organoids we were growing in the culture medium, those are having the accurate physiological functionality, and those could be utilized for the purpose of these kind of experiments. And other way, if you see that at IITR, we have also developed some other models, and those models are accepted, or those data have accepted in US EPA, because for the dimethyl phthalate, we have first time shown that these could be the model for the reproductive toxicity, and that finally it is accepted and just mentioned in the document of EPA for the final scope of risk evaluation of dimethyl phthalate. In the same way, in the OECD document also, classification and the labeling of the dimethyl phthalate. So that means this is the impact of the studies with the in vitro system or the alternative system, because this is we have done with the Drosophila, that the regulatory agencies have also incorporated those models and those data for the further studies and further guidelines across the globe. The other important aspect, what we are looking is that the simple hazard characterization and risk assessment, because if you see that the chemical risk assessment is now being shifted from the descriptive animal toxicity studies to in vitro or the alternative stress systems, and their integration with the predictive approaches, including the computational modeling and simulation. The toxicity data generated from in vitro and alternative test system cannot be used directly in a chemical risk assessment because a link need to be established between the concentration at which cells are exposed and the doses which will lead to those concentration in the target tissue in the animal human, because now we are exposing cells with certain concentration. So that means direct exposure is there, but that concentration is how to correspond inside the body, because maybe we are giving through the oral route or through the IV route, inhalation route, or 5 other routes. So finally, from that concentration, how much concentration is reaching to the target organ or target tissue. So that means to extrapolate the dose which is given in the in vitro and to reaching to the in vivo system, that extrapolation is required. So for that purpose, there is a need to translate this information of in vivo dose response, which can be achieved using physiologically based toxicokinetic modeling. So for that, such toxicokinetic modeling, mathematical description of absorption, distribution, metabolism, and elimination, and other relevant biological processes of drugs and chemical to describe the relationship between exposed dose and the internal concentration level in the blood or tissue. So that means now what we are doing, so we have developed these kind of physiologically based toxicokinetic modeling system. So using this modeling system and the in vitro data and whatever data is available with the rat system, that by doing the reverse dosimetry, we are just making this as a model system just to extrapolate that what with the human equivalence dose estimation and that predictive doses. So that complete exercise is going on, and that we are getting very good results from the starting from the short-term exposure to the long-term exposure studies, starting from the in vitro to the human prediction, finally using reverse dosimetry and using this physiologically based toxicokinetic modeling system. So that is also being done at IITR. And if you see, that very important aspect is that after putting a complete ban on the use of animals for cosmetic testing from May 21st, 2014 in India, there has been a tremendous efforts to develop and validate non-animal models. The efforts have already been recognized by OECD and given approval for the reconstruction of human epidermis, cornea-like epithelium as a human skin mimicking model for skin corrosion, skin irritation, and eye irritation. But so far, none of the validating agencies have received any data for genotoxicity, phototoxicity, absorption, cytotoxicity using such in vitro models. So using these multi-pronged approach, that we are just attempting to make the development and the validation of reconstructed human epidermis as in vitro model for genotoxicity, that micronucleus and chromosomal aberration, comet assay, phototoxicity, dermal absorption, cytotoxicity, and finally, when we just gather this data, that data will be submitted for the possible inclusion as a mechanism-specific safety assessment for the cosmetic products and guidelines. So that means the entire set of experiments are just currently on at IITR using these reconstructed human epidermis cornea-like epithelium model system, and probably in a couple of year time, we will be able to submit this data to the OECD for making a guideline for the genotoxicity, phototoxicity, and that this dermal toxicity as well as cytotoxicity using these 3D models. Besides that, what progress we have made so far, that the facility creation, that the 3D printing and the 3D bioprinting technologies have developed the human specific bioprinted human tissues. So basically, if you see that we are in the process of just establishing the 3D printing and 3D bioprinting facility at our place. This facility creation will enable us to fabricate the highly organized functional bioconstructs of tissues and organs for high throughput screening of drugs and chemicals for their biosafety and toxicity. These micro tissues are expected to produce the similar physiological reactions that the entire organ would, but much on a smaller scale. And this would result in a scalable, faster, and potentially more reliable genobiotic testing platform as compared to the existing in vitro approaches. The 3D material printer has already been installed, and the device has been used successfully to print the tooth and bone prototypes using polylactic acid filaments. And this 3D bioprinting is almost on the verge of installation. And beside that, one very promising project, what we are looking at, that the biorepository of animal organ and tissues. Basically, this other important program which we are going to start is the development of a curated and the well annotated on-site biorepository of treated and controlled animal-derived organs, tissues, cellular and subcellular fractions, and the animal live derivatives such as the primary cultures, immortalized cell lines, stem cell, organoid serum, cerebrospinal fluids, which could be shared to foster the research. A researcher down the line 20 years can utilize the same biological material without sacrifice the another set of animals and resources. And there will be no need to have the ethical clearance, animal house facility, and other resources in the laboratories, and no expertise will be required for the animal handling, etc. So it will be a wealth from waste kind of outcome of this project. And in this project, we have taken already initiatives, and we are in the process of making this facility, because what happened that a long-term exposure we are giving, say for example, with some kind of toxicant. So if we could able to just store the tissue organs of control as well as the treated animals, and from there, if we can just make the cell lines, primary cultures, or the subcellular fractions, so those could be utilized by the laboratories where these kind of facilities are not there, or the expertise are not there. They can simply just take that material from us and utilize for their own research. So that kind of things we are just looking at. And if you see, the other important aspect is, yes, one other important aspect what we are starting, that whatever research is going on in the country, as Professor Y.K. Gupta mentioned very correctly, that he has visited one GLP laboratory where the people are doing with the stem cell and just making the synthetic skin, but they were not aware of that what the other people are doing. So we are working in isolation. So the days have gone, because just to culminate one task, we have to just come together. And that approach is adverse outcome pathway analysis approach. And OECD has already published the adverse outcome pathway analysis for the 600 events. So that means these are the 600 events which are common for the toxicants, starting from the source of the environment contamination and the exposure, molecular initiating, organelle level, tissue level, what the organ level effect, what the system level effect, and what the effect on individual and the community level. So that entire approach we are using at IITR at different projects. So that means we have a dedicated team of 39 scientists with more than 50 technicians we have put it under this project, just to culminate this task, starting from the source apportionment in the contamination in the environment, and that the enzymatic, what the biotransformation is there, and what kind of changes at the DNA, RNA, and receptor level, what the key enzyme and biochemical integrity, and that what kind of exposure markers and then effect marker, the stress proteins, the metabolic indicators, and other things, and what the changes at physiological level, and what the changes at population level is there, and what the ultimate effect will come onto the ecosystem level. So that means starting from the environment to environment, that end-to-end solution what we are trying to, because that exposure in the environment and what ultimately affect on the ecosystem. So environment to environment, what is the entire chain of system is that we are trying to establish under this project. And you will not believe that on this project we are using a bare minimum amount of animals, otherwise up to 80% experiment they are just with the all alternative systems. And when we found very connective thing is required to be established, then only we are using the rodent system. Otherwise, till that point, the entire study is using either the isolated tissues or cultures or the primary cultures or the target, something like that. So for this time, thank you so much for just patient hearing. And if anybody has any specific question, I will be more than happy to answer this question. Thank you so much.
Thank you very much, sir. You are exactly on the time, finished the presentation. Really nice to hear about all this. And I think we have more than 100 people on the YouTube right now listening online and having enjoying, and all of them, they are saying that this is really a fantastic presentation. Sir, now I have only one question.
Sure,
you
sir.
have a great this bioprocessing thing, 3D, and that you are putting together. Practically, we are doing a lot of work, but mostly it is very difficult to work in the issues level, which mostly we are working in a silo. That also been pointed out by Dr. Y.K. Gupta. What do you think, sir, in such scenario, how can we have a good collaboration?
Dr. Vijaypal, you have pointed out very valid point. And if you see that in January 2021, I have published one white paper on the 3 R's in the Indian perspective. And in that, we have given a recommendation to the government of India that basically now OECD and all other international agencies are saying, if you have developed certain models, first you validate those models in your own country and then come to us. So that means right now in India, as such, no separate task force is there to fund such kind of alternative studies, number one. Second is there is no platform as such which can just be listening with the data and the government agencies and the regulators. So just put forward our results to them. So that means there is a desperate need to establish, and probably this society might play some role to just establish a connective link that whatever data we have, we are ready to share that data to this platform, and that platform can just submit it to somewhere or to convince to the government of India just to make a platform. So that means that the validation can be done, because if suppose that tomorrow I'll say, because that making a guidelines, that there is 7-step process. First you do the research, then you submit, and then you do the intra-laboratory validation, then inter-laboratory validation, then submit to the OECD for the blind review. After blind review, you will receive the comments, you have to address those, and then again submit to the OECD, then they will do the open review. And after open review, if there is no comment, that will be there in the public platform for 3 months for the draft guidelines, then it will become the guidelines. So the question is, if suppose that tomorrow I'll ask you just do the inter-laboratory validation with my protocol for my models, simply you will ask that from where the funds will come. Because as such in the country, there is no provision to provide the funds for such kind of validation. So that is the biggest issue or challenge we are facing. So if from this recommendation of this conference, if that those recommendation will go to the government of India or concerned ministry, and some kind of platform can be established, that would be a wonderful idea. Otherwise, we would have been working in the silo and isolation, and at our level best, we are trying to make a network of the, you can say that like-minded persons, and we are just trying to these kind of validation studies by our own resources that are very limited. That is the basically limitations, you can say.
Thank you very much, sir. I think because of the paucity of time, now I pass the floor to the next chairperson of the session. Thank you very much, Dr. Pant, sir, for the wonderful talk. It was nice that you put for all this policy as well as the research perspective together. Thank you very much. And I welcome next chairperson and speaker for taking over the session next.
Thank you. Thank you so much.
Thank you.
Thanks a lot, Dr. Pant and Dr. Singh. Can you guys hear me?
Yeah.
Yeah, okay, great. Thanks a lot. And it's a pleasure to introduce our next speaker, Dr. Francois Bousquet, and he's the speaker of the session. And just to give a brief introduction, although the list of accomplishments is quite long and I'm reading it out. So welcome, Dr. Bousquet. And, so Francois is an ecotoxicologist with a PhD in life sciences, and he's a member of the Society of Toxicology in France. And with 15 years of experience in ecotoxicology and safety testing, and also within EURL ECWAM. So Dr. Francois has scientific expertise in the area of alternate models, specifically in aquatic zebrafish embryo models, and also worked in validation processes defined by EURL ECWAM. At EURL ECWAM, he's in charge of coordinating and validating zebrafish embryo toxicity testing. And with his contributions in developing test methods in developmental toxicity, he has also been honored with a regional award. In 2012, he founded AlterTox to coordinate EU policy programs for SAAE Johns Hopkins and SAAE Europe. AlterTox has also been instrumental in communications to policymakers and scientific community. Of course, Dr. Francois is recipient of several awards like the Loesch Prize, and Dr. Francois has many publications and multiple citations. Welcome, Dr. Francois, and we look forward to your talk on 3R EU policy and research dynamics in 2021. Thank you.
Thank you for those nice words. Let me share my screen. And starting the presentation, I guess you see my slides.
Yes, we can.
All right. So first, a quick outlook of what we will discuss today. I'll briefly present you AlterTox, which is now almost 10 years old company based in Belgium. Some new concepts towards alternative to animal testing that are being used extensively by the scientific community here in Europe. And the policy hot files that we have also with the European Parliament and the European Commissions that are impacting toxicology and the chemical universe. And I will finish with 4 or 5 EU research projects that should be on your radar in order to see where the colleagues are putting their efforts. So that's a poster I made for Eurotox some years ago, and it gives a bit the vision of what we want to achieve at AlterTox. We want to make the scientists better people, and for that, we have set up some soft skills training on scientometrics, on informed evidence to policymakers, but we want also to make the people better scientists, and this is an activity of training that we still have. Even under COVID, we managed to have online in silico training and hands-on training also remotely with organoids. We also want to make the scientist's voice heard, and this is how to spread your key message to policymakers. It's all the dissemination activity, and I will present you some examples in the next slides, and it's also advocacy to the policymakers. So we are developing some tools in order to spread the word towards alternative to animal testing. We try also to innovate on our communication. We are organizing some blog spots regarding the young scientist. Here we had season 1 and we have season 2 this year. We were organizing podcasts for the World Congress. You can still listen to them. We are also doing videos, new also cartoons, press cartoons to show a bit the different activities in Vox Europe or the European Parliament magazine. But we do also podcasts on the 3R centers in Europe. If you are interested, they're all in English. So that the 3R centers were presenting themselves. You have also Adrian Smith on the call, if I am correct, who also presented NORECOPA. And we have the World Environmental Day, for example. So these are the kind of activities we do at AlterTox. but I'll wrap it here and focus more on the toxicology. So the first new concept that is keeping us busy currently in Europe is the new approach methodologies. So it was a term coined by the European Chemical Agency, ECHA. I'll mention it a few times again in my presentation. And it's used to make reference to any non-animal based approach that can be used to provide toxicological information in the context of hazard assessment. So in vitro, in silico, omics, organoids, you name it. The other thing, but I guess it's nothing new also for you, but it's still a corner point to integrate all the work I will present afterwards, is the adverse outcome pathways. So we are looking more at the more mechanistic, molecular level of the adverse effect, and we stop focusing on the in vivo part, which is more traditional way of looking at toxicology, but rather we try to show all the chain of events that would lead to adverse outcome. This is where you integrate your NAMs. I put some example that would illustrate where a key event would be featured by a specific NAM. The more key event, the more NAMs you need. There is, of course, some uncertainty when you use NAMs. Maybe they are not validated, maybe they are not, they are somehow, some elements are more robust than others. You could imagine to also have some safety factors adapted based on the maturity of the test that maybe help and speed up their acceptance. So this is some food for thoughts. Let's talk now about the EU policy hot files that are keeping us busy with the European Commission. The first one is the European Green Deal. The European Green Deal has multiple pillars, but the one that are interesting us today is the zero pollution ambition and the toxic-free environment. Toxic-free means that you should make sure that any substance, whether it's a chemical, cosmetics, pesticides, food additive, etc., that is in the environment is toxic-free. And for that, you will need testing, or sometimes ECHA like to call it data generation. But data generation means, in general, animal testing. So that's the challenge, how we can ensure a toxic-free environment without using animals, knowing that the predictivity of the animal test is absolutely not the best. Here I put the director of EFSA when he was presenting at the European Parliament in April his strategy, and I listed you also his own talk, so you can have a look at it also afterwards. And they have three important information for you today regarding the Food Safety Authority. First, they are working on artificial intelligence and new approach methodologies. They want to have a roadmap how to use the NAMs by 2027, only whenever they need clarification from a submitter, an applicant, they would request additional study only using NAMs. So that's already extremely interesting that the regulators are proactive on this topic. The second thing is the developmental neurotoxicity test, which is in general using a lot of animals and it's not particularly performed nor robust, is being validated as an in vitro test by the battery, and EFSA and the US EPA are highly involved behind this, whereas ECHA, the chemical agency, is still relying more on the in vivo method. About ECHA, so they are in charge of REACH, the European regulations for chemicals. They have done some interesting work regarding alternative to animal testing. They developed this guideline, or they supported the development of this guideline 497, which is about defined approach on skin sensitization. As you all are aware, sometimes one in vitro test doesn't do the job because of the limitation, because of the applicability domain, And the idea of using defined approach for this specific endpoint is to combine multiple tests, whether they are in silico or in vitro, and facilitate the data interpretation procedure. So you can have a look at the 497 and to see what is the strategy around it. There is another information regarding the chemical agency that is useful is the pilot project that they have almost finished normally this year to have a unique chemical database, including the information from the dossier from ECHA, but maybe from EFSA, maybe from EMS, or the European Medicine Agencies, as well as gray, or what we consider gray literature for regulatory dossier, meaning results from PubMed, or studies that are not GLP. I mentioned the Green Deal, and for the toxic-free and zero pollution environment, they rely a lot on the chemical strategy for sustainability. Here on the left side, I'm presenting you the European Parliament proposal regarding this topic. So they want to include new approach methodologies. They want to use artificial intelligence for chemical risk assessment. They would like also to harmonize the chemical safety format with a unique chemical safety database and support the effort of ECHA towards NAMS to have a specific budget. The Commission had a bit different views on that, and they emphasize the need of animal testing in the field of chemicals. You see that's what is underlined. And they say that they need to innovate to reduce dependency on animal testing. REACH revision. REACH will be revised. It's being currently assessed. The impact of the revisions are being assessed. But what will it contain? It will contain more information on critical hazard properties. So they are requesting more information. Which one? Carcinogenicity, endocrine disruptor. What is new is immunotoxicity and bioaccumulation on fish. So you can imagine that more tests also are further needed. And they introduce also the idea of grouping, meaning you look at a category of chemicals and you treat them as a whole and not just individual compounds. So with the phthalate, for example, they would be grouped as a whole. It seems to be so far, but it's still difficult to have a clear idea. It's meant to speed up the work of the agency and reduce the administrative burden. All these revisions will be impacted on the chemical safety assessment for lower tonnage, 1 to 10. Before, the full chemical safety assessment was requested above 10. Now it's 1 to 10. They will look also at new categories like polymers, and they will also consider the environmental footprint. Particularly interesting also under the Green Deal is the one substance, one assessment. So this means they would streamline within the agencies the work. We have example, for example, like glyphosate is being tackled differently depending on the legislation or the use of the product, whether it's for chemical or whether it's used as a pesticide. And the need of test is not the same. So we need more coherence. I mentioned before EFSA, ECHA, DNT test battery for EFSA, in vitro test battery for EFSA, but for ECHA, they still request the in vivo. ECHA is proposing in vitro test method for skin sensitization. EFSA is still relying on in vivo rat dermal absorption. So you see, there are places where they could be a bit more clever and harmonize as much as possible. What is extremely important is that they harmonize the data template. For quite some time, EFSA was following more the WHO template in terms of format, so the World Health Organization. Recently, because they had to get closer to ECHA because of the biocides that is now covered by ECHA, they work only with OECD template. So it's going in the right direction. Let me talk briefly about cosmetics. As you know, in Europe, since 2013, there is full marketing ban, but there are still work around it. The European Chemical Agency has also requested tests for cosmetic ingredients, that they were solely cosmetic ingredients, and they requested animal testing. So what the industry applicant did is said, okay, we don't want to do your testing. We'll go to the EU Court of Justice saying that you are obliged to accept the NAMs or the in vitro methods or that we are providing. We have no answer yet. In December 2020, the Cosmetic Europe company, so the trade association, also sent a letter to the President of the European Commission, von der Leyen, and the President of the European Parliament to alert on this. Thomas Hartung is also joining you later today, and he had published with Constanza Rovida last summer an article in Altex presenting the fact that ECHA is regularly breaching the ban on animal testing for cosmetics. There was a motion of resolution, or resolution at the European Parliament asking for more efforts. And by next year, with the cosmetics, we will have also a vision and an impact assessments with new hazard that will be looked at, the one I mentioned for REACH, as well as nanomaterial will be covered. Last point, maybe I want to cover here on policy is an interesting work done at in the United States. They were looking at last on the predictivity of the model, the in vivo models for human health risk assessment. You know, that is something that people talk about, but at the end of the day, they want to do very carefully this work for each of the endpoints. So I invite you also to have a look at this work. You can register to the newsletter and being informed. There was already a workshop yesterday on this. So let's talk about the EU research project. The first one, Altertox is involved in communication and dissemination, is OnTox. OnTox generic strategy is to create just a second, to create innovative new approach methodology in order to predict systemic repeated dose toxicity effect that upon combination with tailored exposure assessment will enable human risk assessment. We will cover any type of chemicals, pharma, cosmetic, food, and biocide, and we looked solely at systemic repeated dose toxicity, and 3 organs in particular: liver, kidney, and the developing brain. So what we are doing at the end, we will try to collect all the information available in the literature, collect it, connect it with artificial intelligence. And that's the phase 1. Data-rich chemicals with well-known toxicological profile. All their data sets will be included. And out of it, we expect to have a probabilistic risk assessment. So first, phase 1 is your experimental, your training set. And phase 2, we will start ab initio case study with data poor chemicals. So we will use the artificial intelligence, and if we see any gaps, we will do some extra testing on in vitro and in silico models. But there, what is interesting is we are not optimizing any new models. We are only using what is available. It's not another cell assay. It's not another cell line. It's not another organoid. It's already you working with what exists. And you will see it's also true with the other projects I will present you. That's more or less how OnTox is organized. You have work package for each of the 3 organs or endpoints: hepatotoxicity, nephrotoxicity, and the kind of information we are collecting are biological domain, so toxicological domain, chemical domain, kinetic domain. And after that, you integrate all of it. And after that, risk assessment. Precision tox. Precision tox is also a new project recently funded. Like on tox, it was about developing alternative test methods for chemicals. The principle is different. It's to use ecotox model or lower tier vertebrates that are not considered as animal models in the EU directive. So this means Daphnia, this means C. elegans, this means Drosophila, this means fish eggs or zebrafish embryos and tadpole embryos, or xenopus embryos. And the idea is to connect through the pathway of toxicities and through the evolution, an effect in those organisms through the human condition. So that's particularly interesting because it's something we have never seen. That's how the project will look like. We will generate our knowledge creation based on a set of 250 chemicals data. And this data will be thereafter compared with the human population. And to have biomarkers, and these biomarkers will be then used as sentinels or as a key event to know whether we have an issue for the human. These two projects, on tox, precision tox, are part on a more global cluster called ASPIS. So there's a third EU project that I didn't mention because I'm not involved. It's called Risk Hunter. It's the follow-up of UTOX Risk. So these three projects are collectively representing 70 institutions across 16 European countries, worth 60 million euros from the European Commission to develop alternative to animal testing. You can also have a look on this website. Panoramics. Panoramics is a project that just started, and it is to provide risk assessment of complex real-life mixture for the protection of European citizens and the environment. The previous two projects were about single chemicals, but we know that in reality we are exposed to many more. And this is the objective of Panoramics, how to estimate and evaluate and protect the people. So what are the goals? Closing current knowledge gaps on real-life mixture toxicity by using a novel experimental path based on whole mixture assessment for identifying and quantifying the risk of chemical mixtures extracted from real-life samples representing environment and food as well as humans. Providing ready-to-use and practical tools for mixture risk assessments, and the applied methodologies, including a panel of in vitro assay coupled with effect direct analysis and large-scale suspect and non-targeted chemical profiling, are innovative in their combinatorial approach. We will also take advantage of a well-studied human cohort of newborns from Denmark, in whom chemical mixture exposure will be linked to adverse health outcome, and we'll look in particular at reproductive, developmental toxicity, and neuropsychological function. We will do case study to provide this and insight on current, safety margin, need for the mixture assessment factor, as I said, focus on reprotox and developmental neurotoxicity. The basis of this project was from this review article that I invite you to read to know more about Panoramics. From this peer review, they decided to set up Panoramics because they noticed there were gaps. I have two more projects, and this one is also particularly interesting. It's a different dimension. The first three projects that I presented are built around the research community, academia, SMEs, industry, that are involved in this topic. Right now, APCRA, accelerating the pace of chemical risk assessment, involves regulatory agencies from the United States, Canada, Europe, Asia, Australia, and OECD. And what are they doing together? They are engaged in the development of new hazard, exposure, and risk assessment methods and approaches for their chemical evaluation activity. There again, they want to streamline and harmonize also their activity. It was one of their objectives, common understanding of the current state of the science of new approach NAMs, so the NAMs, in the regulatory context. They want to increase cross-agency collaboration to strategically address barriers and limitation of the use of NAMs. They want to determine mechanistic to enhance data sharing capabilities. They want to increase engagement and commitment to develop and share case study of mutual interest. You can see, you can find the case study of APCRA also online on their website. Last project, but not least, it's particularly interesting. It's called PARC. It's the Partnership for the Assessment of Risk from Chemicals. It's 400 million euros for the next 10 years. And compared to the other project I mentioned, this is public-public partnership. So there is no industry, no SME involved, and PARC was set up by the member states. So the EU countries, by France, Germany, Denmark, all together, the regulatory agency said, okay, we need to develop our own knowledge, our own expertise towards the toxicology. We are too much waiting for the industry to give us the information. And they have their own problem. What kind of problems they want to solve? They see that there is a certain number and diversity of chemicals that needs to be addressed, and they don't have the answer for that. There are gaps in toxicological information, and they want to generate the information. They don't have enough info in terms of exposure, and they want to have better access to information and data. And why also they consider that there is public concern and health cost. Here are the skills map that PARC is performing. And I wanted to focus on those: in vitro modeling and methods, mechanistic toxicology, the 3 Rs, AOP network, USAR, Red Cross, NAMS, IATA, but they will also develop test guidelines. They will also want to discuss validation of alternative methods and the development of and validation of method of advance for PFAS assessment. So they are also looking at many things that are of our interest for the NAM community, for the alternative to animal testing community. This is Christophe Roussel on the right, and he's one of the co-leaders of PARC. He's from France, the French regulatory agency ANSES. I made a screenshot of one of his slides. Here we have the full PARC environment. So PARC will not be alone. It will be interlinked with the European Green Deal that I mentioned. I mentioned the chemical strategy, the zero pollution, the toxic-free environment, some of the EU projects. So ASPIS is not presented, but we have UTOX3 that was the predecessor of Risk Hunter. So we will be in there. So they will look also at the EU project and say, how can you feed us with your expertise? But they will also have their own program. I will end here with a few information of things you want to continue at home. So that's the podcast that I briefly mentioned that you can find on our website. There is also a review from the ECFAM Joint Research Center regarding non-animal models in biomedical research. And what I find particularly interesting is Allure, is the EU statistic database on the use of animals for scientific purpose. And with this, I stop.
Thanks a lot, Dr. Francois, for the lovely presentation and giving us a view of EU current status right now. I would just like to ask you one question based on your experience. Given the fact that the AOPs have, established from ecotox itself and now going forward to toxicology, we have had some successes especially in like skin sensitization. What is your feeling that, how it can be, or how close or how far we are for a 90-day toxicology development of a alternate method using, okay, there's this multi cell integrated approach kind of thing. I think you are on mute, Dr. Francois.
Yes.
Yeah. Sure.
About the 90 days, I think it's clearly a challenge. In general, what people do is they extrapolate from the 20 days towards the 90 days. And I know that 28 days are being covered already with organoids. In particular, the company Tissues in Germany is particularly focused on this timeline. Now, looking at the endpoint you mentioned, I might not be able to answer. I would invite you to look at the AOP wiki, because there is an AOP wiki, probably where all the scientific community can contribute. And there is currently also a scientific society on AOP that has been established and is providing training. So this may be our proper places where you can have this discussion.
Okay, great. Thanks a lot. I think Dr. Francois has been kind enough to finish his presentation quite quickly. If there are any other questions for him right now. Well, if not, thanks a lot, Dr. Francois, for a wonderful presentation. And I now hand over to Dr. Manaivanan for the next speaker, to introduce the next speaker and take it forward.
Bye-bye, and hello, Adrian.
Yeah.
Bye.
Thank you, Dr. Rai and Dr. Francois, to finish the session in time.
Thank you.
Thank you. Thank you very much. Now, first of all, I'm thankful to the organizers, particularly Dr. Patil, for having me to chair the session 3. The speaker of this session is Dr. Adrian Smith, and he will be speaking on the topic how to plan better experiments. On behalf of the organizers, I extend a warm welcome to Dr. Adrian Smith and all the audience for this session, that is session 3. Myself, Dr. Manivannan from Vaccine Life Sciences. Ours is a vaccine manufacturing facility situated in Solan near Simla at Himachal Pradesh. And I am taking care of the complete operations of the Vaccine unit as a vice president. And we are currently focusing on manufacturing of the Sputnik vaccines. I have been associated with this society as an executive council member since from its inception. In fact, I have been associated with the concept of alternatives brought by Dr. Akbar Shah in 2006. And since then, we have been contributing many, and we are doing our best for the cause of animal welfare. Right, well, the speaker, we can go ahead with that. Our speaker of the session is Dr. Adrian Smith, and he will be discussing on the topic how to plan better experiments. Dr. Smith is the secretary of Norwegian 3R platform, that is the Norikopa, Norway. He is a veterinarian and he is in the field of research for almost 40 years. He was the chair of laboratory animal science, and he is an active ECLAM diplomate, that is European College of Laboratory Animal Medicine, for almost a period of 15 years. And he is currently the secretary of Norikopa since it was established in 2007. And he has been in the board of Danish 3R Center from 2013 till last month, that is November 2021. He is having a notable contribution in 3R databases and authored in framing guidelines for animal research and testing. PREPARE is one such guideline for planning animal research and testing, and that is authored by Dr. Adrian. We are happy to have such an elegant personality for this session, and he would discuss his viewpoints on how to plan better experiments. Let us welcome Dr. Adrian Smith for this session.
Dr. Adrian, please.
Thank you very much.
30 minutes time, sir, please.
Yes, thank you for that very nice introduction. Can you see my screen?
Yeah.
In the presentation mode, and hopefully you can see when things happen. I put a ring around this address. All my slides can be downloaded as a PDF file from the address on the screen at the moment. I would like to thank Dr. Akbasha for the invitation and the assistance I have received from Dr. Patil from DPSRU, and I would like to congratulate Dr. Gupta and everybody at the SAAE for all the important work you're doing. And I've been listening to the presentation so far. It's been very valuable for me too. So I'm going to talk about a large topic very quickly. So I have a lot of slides, which is why I have given you the address to them. And but I will be finished in 40 minutes. I will tell you just quickly about Norecopa. We are Norway's national consensus platform for the 3 R's of replacement, reduction, and refinement. But we also are a source of global 3R resources. And our motto is to prepare for better science, whether that science involves the use of animals or not. This is our website, which is updated almost 7 days a week, 365 days a year. It has about 8,500 web pages and gets over 300,000 hits a year. And we also produce 7 or 8 newsletters each year. And on the last slide, I'll show you how you can subscribe to those if you would like to be informed of the latest developments in this area. The website includes several databases. Some of those are our own, some are data from the European Commission. And we also have links to about 70 other databases on our site. And I'll just show you a couple of pictures of some of our own databases. This is the one that is maybe best well known. It's called Norina. It's been running since 1991, and it contains information on about 3,000 alternatives to the use of animals in education and training, from schools, alternatives to dissections, through undergraduate training, alternatives to the classical experiments in pharmacology and physiology, for example. And the bottom pictures show alternatives that can be used by students and animal care staff and scientists if they want to learn, for example, how to take blood samples or give injections or do surgery. We also have a lot of our own films and slideshows that are available on the internet, and we have links to other people's resources from around the world. Another database we have is called TechSpace, and this includes information on about 1,500 books related to laboratory animal science. This is one of the latest ones on experimental design and reproducibility in preclinical animal studies. And we have a database called 3R Guide, which contains information on about 400 guidelines from all over the world. This is one that we have produced ourselves, a working group looking into severity classification of procedures involving fish. And we also have written some other guidance, as you can see on the right-hand side of the screen here. But there are about 400 guidelines from all over the world. And if you have guidelines from India or other countries in your area which are not in the 3R guide, then please do let me know and we'll be happy to add them to this database. Also on the website, you can choose if you want to go directly to information on a group of species, if you say just work with fish or with farm animals. We have a very comprehensive webinar and meetings calendar, which has got larger and larger because of the COVID pandemic. There were so many online meetings now. And we also have web pages for previous meetings and those meetings that were recorded if you don't get time to see a meeting live. We've also produced an interactive map of 3R centers, and we have a lot of search filters on the right, which you can use to identify ones that you're interested in. And again, please let me know if there are centers that should be on this map. We we launched this fairly recently. As you can see, unfortunately, there is nothing in India at the moment, and I'm sure there are more centers that should be added. So please help us to increase this. The subject of planning better experiments has been debated a lot among scientists recently. We talk about a reproducibility crisis, and a lot of papers have been written on how we can reduce the poor reproducibility, make science more reproducible and more valid, more robust and more translatable. And there have been very good papers written about the threats to reproducible science, and a lot of these focus on what you might call the mathematical issues of experimental design, like bias and randomization and blinding, low statistical power. As a veterinarian, I am concerned also about the animal-related issues, the facility-related issues, which also can affect reproducibility. And I will focus quite a lot on that in this talk, because I'm trying to avoid a knowledge gap between the scientists on one hand, who are experts on the more mathematical issues, as I say, like blinding, randomization, group size, statistics, and the animal care staff who are very aware of all the issues related to the animals and the facility, which can cause variation in an experiment. This is an older paper by a professor in laboratory animal science in Finland, but he wrote very importantly that if scientists don't contact the animal facility at a very early stage, this represents a lost opportunity which can interfere with the study results and their interpretation. And authors of scientific papers tend to describe methodological procedures down to the smallest detail, but provide minimal information on animals and their husbandry. And this makes it difficult to reproduce experiments or to evaluate the value of the experiments. I call this personally the burnt cake fallacy. This cake is burnt and we can't improve it by describing it. We have to go back to the kitchen and change the baking conditions and maybe the ingredients too. So we can't improve research just by better reporting or by courses in experimental design that leave out the issues related to the animals and the facility. We need to look at them too. And we have had reporting guidelines for many years now, since the 1980s when I started working in this field. And we have the ARRIVE guidelines, which were issued in a new version in 2019, which have been endorsed by over 1,000 journals. It's very important that we do report properly, but we need more than this as well if we are going to do better research. So my philosophy here is that we need to prepare from day one in the kitchen, and then we will automatically produce better research that is easier to sell to the journals. And the analogy is quite simple, I think, here. But planning better experiments is a long process and involves a lot of issues which we don't have time to talk about in detail today. This is an infographic which was made in October this year by the University of Utrecht in the Netherlands, which I like very much. And you can see at the beginning here, it's all about preparation. And I will talk about the prepare guidelines in a few minutes through a lot of steps. And then finally, using reporting guidelines before publishing experiments. The prepare guidelines were evolved over a long period following discussions and writing learning material on courses in laboratory animal science from the 1980s. And we developed planning guidelines many years ago, but we felt that these were too obvious to publish until a meeting in Brussels in 2016, where it was very clear that the community was looking for planning guidelines as well as reporting guidelines. So we published them in August 2017. So what I'm telling you now is actually the result of about 30 years' work. And we looked very closely at other industries to see how we could improve reproducibility. And the aviation industry is a very good example. They have a high degree of precision. They land in the same place on the runway each time, and they work in very variable environments, and they still manage to find the runway where they're going to land under these variable conditions. And the secret of a lot of their success is the use of checklists, even on routine flights, because these reduce the risk of them forgetting to carry out vital actions. They make sure that everything is done in the correct order, and they encourage cooperation and cross-checking between crew members, and also collaboration with the people on the ground, so that everybody is literally on the same page. And of course, it's too late to read all the checklists when you've arrived at the arrival gate. They have to be used before, during, and after the flight. We've made a 3-minute cartoon film explaining this analogy with the aviation industry and animal research. We've got also a lot of inspiration from efforts to make checklists for surgical safety. Atul Gawande has written a very entertaining book you can buy on Amazon about the production of a surgical safety checklist, which the World Health Organization asked him to make for hospitals, which is now in use all over the world. And they also looked at the aviation industry and got inspiration from their checklists. So this was the PREPARE paper published in 2017. All the information is online, and it consists of two things. It consists of a checklist with 15 main points, and there is a lot of emphasis on the 3 R's in this checklist. It's available in 25 languages at the moment, and if you would like it translated into another language that's not mentioned here, then do please contact me. It is designed to be used on a voluntary basis, not as yet another mandatory requirement for scientists, but a friendly aid to memory for scientists, to help them think of all the issues that are important when planning research that may involve the use of animals or animal material. And in addition, this is the list of the 15 topics. There are 3 main groups. The first group is about formulation of the study, literature searches, legal issues, ethics, design. And then a very important section about dialogue with between scientists and the animal facility. And then a section on quality assurance of the methods themselves. And the important part at the beginning, under formulation of the study, of course, is to find out whether it's necessary to do the study at all. Maybe from the literature, we can extract information about previous studies and do a systematic review of the data in them and come to new conclusions without having to use animals at all. So PREPARE is not just about reduction and refinement, it's also about replacement. And here I've highlighted elements in PREPARE which are not typically highlighted in reporting guidelines. A lot of things on this list here do not have to be written into the scientific paper when you publish it, but which must be thought about before the experiment to improve the reproducibility and quality of the experiment. In addition to the checklist, PREPARE consists of a website where there is information about each of the 15 topics and the subtopics. And here you will find links to quality guidelines and scientific papers from all over the world, giving advice, for example, on blood sampling volumes or injection volumes, housing and husbandry, anesthesia, analgesia, humane endpoints, experimental design, etc. And this part of PREPARE is being edited and updated all the time as new guidelines and papers appear. We've also added a section recently for fish researchers because there are so many extra challenges when using fish living in a water environment. We have also links to other people's resources, of course, other 3R centers. This is the UK center, the NC3Rs, and the RSPCA, excuse me, in the UK, who also have a lot of very important information on how we can implement the 3 Rs in research. The ARRIVE guidelines, which I've already mentioned, are reporting guidelines. They also have a lot of good information about the issues that have to be reported, and we have links between PREPARE and ARRIVE so that it's possible to access their resources from PREPARE as well. I'd also like to mention 3 S's, which we haven't talked about yet today. Carol Newton was an American biomathematician, and in the 1970s, she proposed the 3 S's. Good science, of course, is what everybody is aiming for. Sometimes we can't find the answer to a scientific question in the literature, so we have to use our common sense. That's good sense. And also we should use our heart as well as our head when we're planning experiments. That's the sensibilities S here, meaning that if, for example, we're not sure whether an animal is likely to suffer, then we should give it the benefit of the doubt. And if we would find a procedure unpleasant or painful, then we must assume that the animal would as well. So often we have to use the 3 S's when we can't find answers to our questions in the literature. And we have a paper about this at the website on the screen now. PREPARE also is all about threat and error management, which is an important issue in the aviation industry as well. Everything we do when we plan experiments contains a certain degree of risk or weaknesses to the protocol, and we have to make sure we put in areas of defense or redundancy to avoid these weaknesses becoming major issues. So one of the things we suggest very strongly is that scientists and the facility together have a detailed contingency plan based on a risk assessment of the experiment and the facility, covering all the things that might happen during the research, with standard operating procedures for the important events like, for example, acute illness or injury. And there is a lot of advice on the NORICOPA website about this. And it's particularly important when temporary staff are working weekends and holidays, and when scientists are coming in outside normal working hours, people who don't know the facility as well and need to find advice very quickly on how to react in an emergency. And a lot of these have had to be revised or supplemented in the light of the COVID pandemic, as you can imagine. There's a lot of increased focus now on these plans, particularly when lockdown started last year. And we've collected a lot of these suggestions and put links to them on a separate webpage on the NORICOPA website. Another thing that we mention is the need for what we call a master plan, and that is a simple way of making sure that scientists and the facility remember all the procedures that have to be done during the course of an experiment, but which are done more rarely, for example, just once a month or once every couple of months, which may be forgotten. Things like servicing equipment, calibrating instruments, disinfecting rooms. And there is this is a suggestion for a simple plan. It's based on a holiday planner where you write down the procedures in the left-hand column and you put open circles in the weeks where these procedures have to be performed. And then the scientist or the facility staff can add their initials inside the circle when they have done it. And it's a good way of discussing the progress of a project and making sure that there are standard operating procedures for these procedures and making sure they're not forgotten. And we have more advice about this on the internet as well. And also the need for a contract between the animal facility and the research group, making sure that there is a clear division of labor and responsibilities and costs at all stages of the experiment, and that all necessary data are recorded. And this is really important to avoid the waste of human resources and animal lives. Think of, for example, of a situation where a scientist does an experiment and then comes back to the facility a year later and says that they think they're going to get their paper into a highly respected journal, but the journal is asking them for information, for example, the temperature in the animal room. And if they go back to the facility and the facility say, well, we didn't measure it, we thought you were going to be doing that, and nobody did measure it, then there is a big problem. And it's very important before an experiment to make some form of contract with the facility so that everybody knows who is doing what, and there may be extra costs involved here so that everybody is aware of who is paying for these this work. If things go wrong, then we should learn from them as well. And I would like to mention that there is a German portal for reporting critical incidents called SAAE-INDIA, where you can deliver an anonymous report on some accident or near accident that occurred in an experiment or a facility. This is then evaluated by an expert panel who comment upon it, everything anonymously, and then they put the report on this website so that other people can learn about what happened and ways of avoiding it in the future. We also think it's very important when planning for better research to ensure that there is a good culture of care in the facility and in the institution, so that everybody working there feels respected, they feel that their voice is listened to, so that even the people just changing the cages or cleaning the facility have the confidence to go to the managements and discuss concerns they have about the animal research or the way the facility is being run, without any risk of reprisals and being accused of whistleblowing. So a culture of care is all about improving not just animal welfare and scientific quality, but also caring for the staff. And a further dimension to this is transparency to all our stakeholders, including the general public. And there is now an international culture of care network. It has a website, so you can see the address here. NORICOPA is the host for this network. At the moment, there are members from about 14 countries, and we welcome members from India and other countries in your area as well. And there are a lot of resources on this website with advice on how you can improve a culture of care, and infographics and other information which can be downloaded free of charge. To help the dissemination of advice on how experiments can be improved, then last year we launched a wiki for refinement in particular. You can see the address on the screen here. And the idea behind the wiki is the fact that a lot of good ideas circulate among care staff, and we read about them on discussion forums, but they don't get published in scientific papers. So the wiki is designed to be a portal for rapid publication and dissemination of these ideas. And it looks very like Wikipedia. It has pages with text and links and photos and films. And I am the general editor for this, but anybody can apply to have their own personal username, which is anonymous, and they can then log on and add information themselves. And people can also send it to me if they don't have the time to enter it themselves into the wiki. At the moment, there are about 60 topics on the refinement wiki, and these are increasing all the time. The idea of this wiki was actually that of Susanna Luimis, who is the scientific policy officer at the EU Commission, who is responsible for the EU directive on the use of animals in research. So we thank her for her encouragement. And I would also like to mention her website, the Commission website for the directive, which has also a lot of good links to resources on how to plan better animal research. So our hopes for the PREPARE guidelines, which I've been talking about, they are, as I said, uptake on a voluntary basis. So we are looking particularly at interests from funders and animal care and use committees, regulators, institutions, animal facilities, not the journals, because that's too late in the process. That's why we have reporting guidelines. And of course, also scientists, both early career scientists and principal investigators. And pre-registration is also on this list. Some journals now are beginning to accept protocols for pre-registration and peer review before the work is done. This is a very good way of making sure that protocols are improved before the work is started. And it also guarantees the scientists that their results will be published, even if the results are negative or inconclusive. And we are collecting a list of endorsements of PREPARE on the website on the bottom of this page. One of the recent endorsements was a report by the NIH, where PREPARE is mentioned as one of the standards that will result in higher quality knowledge base and will better inform future research. And so we hope that you may find it possible to endorse PREPARE in your institutions as well. So we hope that PREPARE will not just be looked upon as another set of guidelines, but that scientists will be able to say that they arrived because they were prepared. When they submit their manuscripts to the journal, they will have answers to the questions which the journal editors and the referees have, because they have thought about them during the whole process, before they started and during the experiment. So they won't be in for a surprise when they submit their manuscript to the journals. And this is a win-win-win-win situation. It gives better science, it gives better animal welfare, it advances all the 3 R's. And there is a health and safety benefit as well. It gives a safer working environment for both the humans and the animals in the facility. There is also a great responsibility on the shoulders of the scientists for better experiments. This is just an example. Some scientists in Norway in the 1990s wanted an alternative method for taking blood samples from rodents, and the animal care staff at their facility found this vein on the back leg of mice and rats, the saphenous vein, which was easy to take small blood samples from. And they used this method, and it was very successful. It had not been used previously in Norway, and I think was very little known in other countries as well. So they published their results, but this was the title of their paper. And there was no indication here that this was a new method of blood sampling rodents. It was just one sentence in the materials and methods section. And we had to write this paper a few years later to highlight that this was a new method for blood sampling animals, which was a lot less invasive for them. And we encourage scientists, if they develop a new procedure that implements the 3 R's, to publish it as a separate method paper. It doesn't have to be in a high impact journal. The most important thing is that this information gets out to the internet, to Google, that it is indexed in databases so other people can hear about it. So what we're trying to do in Norikope to improve animal research is to avoid the gaps between the different specialists who often work in their own silos. So we're trying to build bridges across these gaps between the in vitro experts, for example, who we just heard about from Francois, and the laboratory animal specialists. And there are a lot of platforms now, and our job is to try and bring these together so that we can advance the 3 Rs using all the techniques that have been developed by individual specialists. There are a lot of good papers about bridging these gaps now. This was a report produced recently by the Joint Research Centre in the EU. And this is another paper I can recommend about advancing non-animal methods and applying these to basic research, where we have the greatest challenges to replace animals, I think, and improving their relevance to human biology. And I think we need now to look at a more human-based approach to science rather than continuing to humanize the animal models. We need a paradigm shift here towards the non-animal approaches, the non-animal methodologies that was mentioned in the previous talk. So I would like to end by thanking all those institutions and societies that have sponsored the work that I've been describing quickly now. And I'd like to remind you that we produce a newsletter in English, which goes to over 1,000 international subscribers at present, where we give you information on the latest advances in this area and how you can plan better research. And you can subscribe to our newsletter by going to the bottom of the pages on the NORICOPA website, and there is a white box where you can add your email address and register for the newsletter. The next one will be coming out towards the end of next week. And again, I'd just like to remind you that all the slides I've been showing you, they are available at this address, noricopa.no/SAAE. And with that, I'd like to thank you for listening. And I think I'm within the time, so I'm very happy to take any questions or comments if you have any. Thank you for listening.
Well, thank you, Dr. Adrian. Definitely you are in time. You finished your presentation in time. Thank you very much. Very nice to know about your databases. Certainly they are the good resources for the students as well as researchers. Of course, we from vaccine industry may not do away with animal testing, but we do support 3 Rs and practice also 3 Rs wherever possible without compromising on the regulatory issues. Indeed, we are successful in eliminating animal testing in topical medicines. And we did find some alternatives for topical medicine testings. And your PREPARE is a very good guideline for industry research particularly. And of course, the take-home message is, apart from 3 Rs, we need to take home the 3 S also, that is good science, good sense, and good sensibility. Thank you. Organizers also conveyed their sincere thanks and gratitudes to Dr. Adrian for sparing his time. Thank you very much.
It's my pleasure. Thank you very much.
Over to the next speaker, please.
Am I audible? Hello?
Yes, sir. Audible, sir. Please continue.
Yeah.
Sir, you are in mute, sir. Mute, sir. Dr. Akbar Shah in mute.
My slides are.
I'm sorry. So I have great pleasure in welcoming Dr. Mohanan to present his talk on multi-organ on a chip for biological evaluation. Dr. Mohanan is a very senior scientist, very effective and efficacious, and he is taken over the latest trend in the in vitro technology, particularly applicable in the alternatives scenario, though he had been doing a lot of other domains of alternatives otherwise. Dr. Mohanan is one of the executive committee members of the Society for Alternatives to Animal Experiments, and he's basically conducted a lot of research on alternatives and in vitro toxicity technologies. I welcome Dr. Mohanan to make his presentation. Multi-organ on a chip for biological evaluation. Presentation shall be for 30 minutes.
Thank you, Dr. Akbar Shah. My slides are visible, right?
Yes, sir. Yes, sir.
Okay. So thank you so much for giving an opportunity to present my work here on the multi-organ on a chip for biological evaluations. And just I would like to project about my organization. So I'm from Sri Chitradenal Institute for Medical Science and Technology, which is coming under Department of Science and Technology, Government of India. We have three wings. One is the tertiary care hospital for cardiac and neuro specialties. And then we have a biomedical technology wing where the medical devices and all are developing. And we have from prototyping to the clinical trials facilities and the Achulmano Center for Health Science Studies. And the biomedical technology wing, the objective is the promotion of biomedical engineering and technology. The main operations are medical device development, then medical device evaluation, applied research activities, and human resource development. And you know that we developed several devices, and I have shown here very few, and around 15 are there, and which is the technology is transferred to the Indian companies from starting from the north to south and to the west, east. Okay. And these are some of the things are the blood bag. The blood bag, which is available in Indian markets, is developed by us only. And it is, what is that? It is marketing in 75 countries as of now. We have oxygenator that's also in the clinical, in the market. The heart valve, which carries more than 1.2 lakhs people. And all others are in related to the patients. And you know that we have around the patent granted in Indian side is around 125, and patent granted is sealed from the outside India is around 19, and the filed patent applications in India is around 129, and the filed patent application in outside India is around 11. And we have around registration, that's design registration around 46 and trademark 8. And the patent to commercialization ratio is more than 30%. So whatever we developed, our aim is to go to the patient. That is our ultimate. So whatever we developed is around 30% is in the market now, means in the patients. And you know that our institute, specifically I'm telling about the biomedical technology, and where we have for the medical device development, which includes the material qualification, then biocompatibility, and also the physicochemical characterization of the materials. And with respect to product evaluation, we have bench test, then simulations, then in silico studies and accelerated aging. Then we have the large animal studies, which includes the efficacy studies and the safety studies. Okay, and then the product release, the sterility, pyrogenicity, and residual analysis. These are the main, and our institute is accredited by COFRAC France. The only one institute accredited by COFRAC France is Srija, and we got certification in 2003, and 18 years we completed this certification. Yesterday and day before yesterday was the last surveillance inspection by the France team. And with respect to my subject, I'm going to present here is the multi-organ on a chip for biological evaluation. So today I read about a review on this, and which is recently published. That is on March. It was published in the August 2021. So, which is very clearly mentioned about the multi-organ on a chip, and which is a systemic approach to model and decipher the inter-organ communication. I'm just focusing this here with a few of the slides, the background about the work and all. And then I can tell you about my work and what is our status or what is our contribution to the Indian community. And we are not against using animals. Our main aim is to reduce the animal usage. So you can see the multi-organ on a chip is basically a microfluidic devices. So what is microfluidic device? You know that it's a miniaturized device made up of a variety of substances from polydimethylsiloxane to hydrogels. You can make up with any of these things. And you know that when you do with this device, you need the microliter of volume of the reagents or a drug to circulate into these devices. And each device is having different organ, it's representative organ. I will explain later. And it's highly specific assays, and it's precise control over the flow. We have a flow control, that is microfluidic flow control is there. So we can regulate the flow in par with our blood circulation. And then it's a cross-section geometry is 10 to 1000 micrometer. The diameter is equivalent to our hair. Okay, the diameter. Then low Reynolds number, that is the high viscous force, and it can deliver nutrients and chemical gradients in a controlled manner. Suppose if you want to treat with all the organs also, or if you want to focus on a particular organ also, we can do with a controlled thing. And it's prominent platform to explore cellular response. And you can see here, it has a vacuum chamber, and there is an inflow and outflow, and with a porous membrane and all. I will explain the subsequent slides. And what organs is, it's a general thing. We can get it from anywhere. What is organ in our body? So organ consists of 2 or more tissues with unique functions. And it has a blood perfusion through endothelium-lined blood vessels. And it's regulated by mechanical force and blood flow. It's controlled by chemical gradients and molecular factors, and physiologically linked with the other organs via blood circulation, immune cell infiltration, and during this. And here you can see the microfluidics also having a systemic pathway. So same way, this we incorporate it into a micro device like the organ on a chip or multi-organ on a chip or human on a chip. The main function is to simulate these functions in an alternative way. I just go to the organ on a chip. Everybody knows it. Last several years, this was in the talk with everybody, and you know that this is a very good. What is that in the new generation? You can very well apply the advanced version of this organ on a chip to evaluate the biological response or the disease modeling in a different aspects. You know that it is the organ on a chip is a microfluidic chip containing cells which recapitulate the organ levels, functions for drug screening, toxicity, and therapeutic applications. And these systems can enable the specific tissue environment with a precise mechanical, fluidic, and structural control, which has in some of the things around 5 mm size width and around 2.5 mm the depth. The cells, the device or the what is that? The well is such a small thing. That is 5 mm the depth and 2.5 mm the length. And it can accelerate the drug development by controlling the fluid path by microfluidics. And it can produce more reliable results than the animal models because the animal is having animal cells and with a systemic response. But here it has the human cells with a systemic response. So the more reliability, you will get it from here. The term organ on a chip was invented by Donald Engler, which is who is the founding director of the Weiss Institute of Biologically Inspired Engineering. So what is systemic? So I want to explain. It's an interaction between multiple organs are essential to ensure the proper physiological functioning of the human body. Although organs are physically separated in vivo and their communication is mediated via the blood and lymph circulation by various signals to maintain the overall viability and homeostasis. Like this, here also we have the connection with the fluid control, okay, with the microfluidic techniques. See, here we can see the models available with the organ on a chip. In different models you can, or the different model is available for different type of application. And you can get the blood-brain barrier permeability, you can do that, the neurotoxicity, then toxicity of inhaled compounds, the cardiotoxicity, neurotoxicity, sorry, anti-cancer prodrug activation, the metastasis, toxicity of anti, there's several things. The important thing what I am looking is the ADME and T, that is absorption, distribution, metabolism, excretion, and toxicity. This is very important as far as a toxicologist is concerned with respect to the preclinical evaluation. So you can make any of the organ, okay, in a single organ or with the multiple organs, you can do it. And in a series, you can join together to keep a multi-organ, or in a single organ also, you can create and do the toxicity specifically. Okay. The next is multi-organ on a chip. A multi-organ on a chip device is a biomimetic system built on a microfluidic chip in which the cross-organ communication is established by allowing the study of a multi-organ process and modeling of the systemic response. It is nothing but in a model or in a device, in a system, you can keep one or two devices or more than one devices or 4 devices or 5 devices you can keep it. So that is a multi-organ. You can do a single organ in a chip as well as the multi-organ on a chip. And even now people are working on 10 organ on a chip, and it's named as the human on a chip. And the modeling of inter-organ biochemical crossing and ADME profiling of drugs and of cellular trafficking across the multiple organs. So this is nothing but you will get multiple organs to do for a biological evaluations. So you can see here 2 major approaches are being pursued to realize the multi-organ platforms. See, here we can see you can individually make organs, okay, and then you can join with or coupled with the capillary connection. Then you can keep it as a multi-organ. Or otherwise, in a single platform, you can keep multiple organ and do your evaluation, which is connected to the microfluidic system. So the main ways are, one is the individual, the organ on a chip, and this organ on a chip individually you can make it and connect it or coupled with capillary connections and to make it as a multi-organs. Or you can keep it in a single platform, you can keep multiple organs or multiple wells. You can do it's also multiple organs. And if you can keep in the multi-organ more than 4 or 5, and there is the recent or the latest the trend is the human on a chip. It's more than or 8 or 9 or 10 organs. Here you can see the multi-organ on a chip is the perfusion is based on, one is the direct, the other is the circulation. You can see here, this is multi-organs and which is connected to capillaries. And then you know that this is the toxicant and it is the fluid, the controlling area, and which each and every organ and then goes to. It's a one way. Okay. it is one way. You're exposing your compound to the organ on a chip, and it is coming here. Okay, and this is again with the single organ and multiple organ on a single plate. You can do in a similar way. It is only one way only. Okay, and then you can do recirculation. For our system, you need a systemic response. So here you can see this is an inlet and outlet. It circulates like anything. Okay, and here it is a fluid controlling system where you can adjust the flow rate in par with our human blood flow. Okay, and here you can see the multi-organ on a chip and with the circulation, and then you can very well do the toxicity with respect to the multi-organs. You can do with the ADME studies or disease modeling. Okay, and these are some of the multi-organ on a chip devices available, which are already people, the scientists globally, they are working on many aspects. Some are working in the with respect to the disease model, the cancer, or many things are there. And then this is mainly the toxicity screening. And when the undesired side effect of the therapeutic treatment are being evaluated, then you can use the target organ and the organ where side effects are expected, like the kidney or the heart or the brain. You can make a single organ and expose this compound. You need very, very, very less quantity. In microliters, you can expose the compound, and then after maybe with the 3 hours exposure, or you can keep it 1 hour is an acute for up to 24 hours you can, or you can keep over 5 to 7 hours per day for 7 days, like our acute toxic or subacute, how you used to do the subacute toxicity like that. Here you can do both the acute and subacute. The acute toxicity is an exposure of a compound within a period of 24 hours, single or multiple exposure of a compound within within 24 hours. That is the acute toxicity as per the guidelines available. And here also you can use the same thing. You create an organ, then expose the compound, say a single application, okay, which can be passed in a one way only, okay, and then you can do its toxicity, the cell assays or other parameters and all. And if you want to do the subacute also, what you can do, you can circulate the same compound, the fluid which contains the synbiotics, then you can pass through in a circulating way, maybe for 2 to 3 hours per day, and like 7 days or even the 28 days, the reports are available. And then you can do the drug metabolism with multiple organs. You can target the supporting the liver target organ, which communicates in the same way. And you can do the pharmacokinetics also, what will be the effect after exposing your compound with a single as well as multiple organs. And mainly, you know that when you do a toxicity, and there are several ways. And when you are, the intended application is the oral, you can put it in the oral mucosa. And if you want in the dermal, and you can put it in the skin. And if you want to the inhale, you can put it in the lungs tissue. So like that, you can in a different way, you can expose the compound which mimic the regular exposure of the other compounds. ADM is very important, you know, that once a compound is enters into the body and it circulates, and there will be an absorption, and then it's distributed through the circulatory system, and it reaches the blood, there it metabolizes, and some of the chemicals are the as such is non-toxic, but goes to the liver, there it metabolizes, and that metabolic product may be more toxic than the parent compound, and then it goes to the kidney where it excreted. You know that the metabolism is nothing but a compound which is more water soluble. The liver, our liver is having a capacity to detoxify many of the things. So it converts into a more water soluble compound and then excrete it out. And if it completely excreted out, you can very well say that it is non-toxic. But if it is a repeated toxicity, there some case there will be a cumulative effect if something is remaining there. So those studies also you can very well conduct it with this type of the multi-organ or human on a chip. And this is the trend nowadays in globally. And you can do with the cancer metastasis, any disease modeling also you can do with this organ on a chip. But when you do an organ on a chip, what you can do is, in a single plate, you can make around 8 or 9 or 10 the organs. And all the organs are normal. In one of the things, you can expose the compound. Okay, or you can keep a cancer cell. If it is a therapy, you can, in one of the well, you can put a cancer cells and all others in the normal cells. Then you can directly apply your compound in a particular way. You know that you can make a path where a single application, a single site you can do. In a targeted thing, you can do with the organ on a chip or in a multi-organ on a chip. So in that case also you can, or you can check the carcinogenicity also you can do that while exposing all the organs where it has the multiple tendency. Yeah, and this is about the multi-organ on a chip. Now I am just talking about where we are now, globally where we are now. And this article that was published in 2006 in Altex. Okay, you can see here, this is the roadmap or decision making. You can see this was initiated in 2005 or much before 2005. The target was 2005 to 2010 to develop an innovative solution that is single and multi-organ for medical product safety. And where it's a single and multi-organ was planned till 2015. And then non-initial of the medical product safety, that is industrial application. And then 15 to 20 years, the human body on a chip, that is human on a chip. And then you can see the mode of action, its assessment, toxicity. And you know that then it goes to the validated safety assays, which is planned in the 2020 to 2030. And by middle of 2025, globally, we are expecting that a device, a human on a chip with a multi-organs, okay, which is intended for doing the systemic toxicity testing or disease modeling on chip for a clinical trials. That is between 20 to 2030. But I think globally, the people are ready for 2025. Human on a chip, and that will be validated hazard identification and systemic efficacy assay by 2030 to 35. I don't know whether we can say that a total elimination of animals by the end of 2025. Okay, but we are expecting, and it's not a total replacement, but at least we can reduce a 75% of animal usage. And finally, you know that if you are getting around 10 or 10 chemicals or 100 chemicals out of 100 chemicals, everybody knows that how long will, how many years require for developing a drug. It takes around 9 to 12 years for developing. And by this method, you can screen out many of the product within a short span of time and without killing animals. Once your chemical or the compound is okay, or it has a good efficacy, it has a non-toxic and then such chemical only you can do with the animal trials. So that will be a very good solace to the community. And you know that this is about that roadmap, and this we all wanted to think about it. So our contribution on this aspects, or with this what is that the new area, the new generation technique is, you can see here. You know, I got a project from Department of Science and Technology 3 years back that is for the development of human on a chip. Okay, and that was in 2009, and immediately the COVID has come, and no equipment and no cells, no recruitment, nothing was there. And 2020, but somehow we managed with we got one person in the 2020 in the nearby places. So we started the work with the human on a chip, and our aim was to development of a human on a chip for toxicity as well as the disease modeling. And you know that our main aim is the fabrication of microfluidic chips, and that we succeeded. The development of human on a chip, yes, at 70 to 80% we succeeded. Development of microculture on developed chip, yes. An assessment of repeated dose toxicity using human on a chip, that is in the pipeline. And we got all the cell lines and everything recently because we need the human cell lines. We got it from the ATCC. And then the assessment of pharmacokinetic and toxicokinetic using human on a chip. So my aim is to at least we have to contribute a little bit to the scientific community for the ADME, the profiling and the disease. And you know that the disease model or the human on a chip, it's a state-of-art technology. And this is with the success of the organ on a chip. This is a microphysiological tissue culture system has stimulated the researchers to challenge a more systemic level in vitro human biology through a human on a chip system. And this system aims to combine several organ equivalents within a human-like system, which having a metabolizing environment or aim at in vivo like pharmacokinetics thing. And it is something like a simulating thing you can do with the, later you can do with the in vivo like atmosphere. It's a micro environment, create a micro environment and expose the compound and to see its response. And you know that our main aim is to extend the capacity and to do or to get the ADME, that is absorption, distribution, metabolism, and excretion profile of a compound while using the human on a chip or multiple organ on a chip. And the ADME profile is crucial to analyze if a drug reaches its intended target and has a therapeutic effect or not. So the human on a chip, the concept of human on a chip have evolved over the past few years from a conceptual idea to a possible alternative for animal models. And the potential of the system is now universally recognized by scientists and other pharmaceutical industries and government authorities and many other regulatory agencies too. And you can see here how we do the fabrication of a device. This is a very complex procedure. You need several equipments, high-end equipments, which include the photolithography and all. And we have all this equipment now. And you know that it has a pre-fabrication stage, a fabrication of device, and then post-fabrication. This I'm talking about only the fabrication of the device, and the later assay is there. Once you are familiar with these techniques, you will be very comfort in doing the experiment. And you know that initially you might think that this is difficult, and this is very simple when you compare with an animal experiment. And there is no ethics, and there is no what is that the other the issues related with the, you don't go to the ethical committee for this type of things. So just I'm talking about the fabrication. You know that when I'm talking, you may get little bit only. And if anybody is interested, we are very happy to demonstrate those things to the government, the institute also. And because you know that this is the need of the hour. And you can see here, it is the prefabrication of devices. And you know that you have to make a pencil drawing now. You sit together with your people and what is the design you needed and how many organs, how is the flow, right? And is it equally, the toxicant is equally reaching all the position, or when it reaches where it goes to the first. So if it is the skin, it goes to the first, the liver, or if it is in the oral, you have to go to the neck. So like that, you have to plan. So accordingly, you have to make a pencil drawing first in your maybe the lab book or anything. And then you can design this chip by using a CAD software. And then you can do a multi-physics software simulation studies. Also, you can do how the flow is going, where it reaches it, and what is the velocity there. And all you can get it from this the simulation studies. In the coming slide, I can show you those things. And once the fabricated, the pre-fabrication is over, the design is ready, simulation is ready, we can able to see that this will function or this will works. Then it goes to the fabrication of device. The fabrication of device is, you know, that it is the mold fabrication, and which contains, it has a protective layer and the photoresist, then the glass slides and the protective paper and everything. Then you can go to the, it has a rotation with the 6 RPM at 100 degrees centigrade by the molding this fabrication, and where you have the photoresist lamination to the glass slides, and then it goes to the photoresist laminated glass slides. It has, we have an RDL film, which you can get it outside, and this you have to keep on the slides and then make a photo mask aligned with a UV light exposure. And you can see this, your drawing is clear here. And then you have to have a pre-baking at 150 degrees centigrade with 5 minutes. And then you can, and this RDL, there is a developer like the old the photo developing system, okay? And then you have to, with a developer solution at 150 degrees centigrade, you can put it 30 minutes and you can see the developing the mold development and the hard baking. You can get the this type of thing, and then you can do this the mask, the photo mask. You can keep it in the either PDM MS or other the material, or the other the material you can we can take for the fabrications, and which have again the several process, and we usually do with the PDMS, and over that you can make the device. Finally you will get a good what is that the PDMS organ on a chip with a good what is that, well, and or multiple or multi-well plate. You can get it like this, okay? Here the design again, this is a very simple design, you can see, okay? And this is a slide you can see here with a diameter of 2.5 centimeter. Our the pathological slides, no, the same slide on it with a 4 centimeter. The length is 4.5 centimeter and width is 2.5 centimeter. And it has a well like this. And you know that the depth of the well is around 5 mm. And the length, it is around 2.5 mm. So this is the plan you can see here. Okay, this is the initial molding. This is the well. And by using this mask, you can make a PDMS flow like this. You can see all the lines. And these lines are the diameter. You can keep it. It is equivalent to our hair. Okay, and you can keep to 110 to 1000 micron. Okay, so this is the well, and it has a bottom layer. This is for the culturing the cells, and over that you can keep it there. And this is the flow. The cells will grow here, and this will keep it here. And this is an inlet and then outlets. Okay, and you need here, it's only microliter of the compound to get an idea about your okay. So here you can see here. Oh, that video is not working. So this is the way. There is a video thing is there. It is not coming. Okay. So here you can see the organ. Around 10 organs are there, and this is the way. And here is the in and outer way. So here you can see the concentration, and when start, it's a stimulation. It is there, but it's not working now. I don't know how to do that. It was working in the morning, but I don't know now. Okay. So the fluid will flow like this, and it will come here. So it reaches here, and then it spread like this. Then it equally you can. So it depends which organ you want. Okay. This is the area of exposure. Then generally you can keep it liver here. Or if it is in the inhalation, you can keep it the length also. You can keep it. Or the way you are exposing like that. And the concentration, if the red color reaches everywhere, that is the maximum. Okay. So like that, it is not running. Okay. So this is the prototype of the proposed device. So this is the software, and this is the microfluidic pump, and this is the solution where you have your toxicant and all. Then it has go to like this, and then this is a circulation thing. Okay, this is a one way. So this is circulating like this. So you can do with one day, few hours, or multiple days with a few hours, and you can keep in a clean room where we have incubator, and you can do everything here. And if you want to take the capacity or the potency, the efficacy of your the flow or the liquid, okay, you can take 20 microliter of this fluid. Then you can do all its what is that? Is it the pH is okay? All other nutrients are there or not? You can very well do daily. So like that, you can the same well or the same device, you can keep it for 7 days and to see its repeated dose. Or in a single day, you can expose the 3 to 7 hours and to see its cellular growth and its other potency and all. This is also the same. Like here also that the simulation is there, but it's not working. I don't know why. So you can see here this flow. The flow is running like this. You can see the blue color. Okay. Once the blue color reaches every organ, then it circulates. Okay. And here you have to do that. Is the time? So it's going to come. Okay. And then I can just run. This is the cells and all. And here you can see that we took these cells and do all the assays for doing this. And this is another device with a 10 organ. This is a device with a bottom layer. This is an upper layer. And you know that there is micropillars are there. And there is 3 layers. One is the bottom layer with micropillars. Over that there is the semi-permeable membrane. And above that it is a flow. And these two things are which you can directly expose the compound via the openings. So this is that device. This is the latest device with 10 organs. And here you can see a top layer and the bottom layer. And this is the vascularized. You know that at the bottom layer with an endothelial cells, and over that there is a semi-permeable. Then the cells of your interest. And then over that the flow will be there continuously with an inlet and outlet. Okay. Here also there was a flow is there, but it's not working. And you know that this is a cross section and it has the PDMs and this glass lights and all you can see here. And what I want to ultimately say is, you know, when you do a cytotoxicity with the human cells or animal cells, what is ultimately is the human or animal cells direct exposure, you will get the results. And when you inject into the animals, where you have an animal cells with a systemic response, okay, but you are extrapolating that result to the human. But here you are using with the human cells with a circulatory system, with a systemic response. So this system is more reliable to or more closer to the human on a thing. Human cells with a systemic response, you will get a better results. And the ultimate aim is to minimize the animal. Okay, and these designs are we registered the designs and we patented all these designs and all. And thank you so much. And I think 3 minutes I took extra. I'm sorry for that. And if there is any question, I'm happy to answer. Sir, you are under mute. Unmute, sir.
So thank you so much for your very precise and wonderful presentation. You have made organ on chip as a topic very lucid and understandable to the audience and this attendees. Perhaps many of these attendees are listening to a talk of this kind for the first time, organ on a chip. Otherwise, it is something a myth like whether it exists at all. But you have made it possible to, as a person who has taken up a project on this, executing a research on this topic, you have made it really very understandable, easy for the viewers and the listeners to understand and carry home the message and motivate them, get them motivated towards taking up projects of this kind. And it is, as you may be aware, you came close to that point. By 2025, we expect animal experimentation to be almost wrapped up and there will be like a non-animal method, a human on a chip coming up, taking their place. And you may be aware that NIH and the EPA have almost declared that 2030 is that ultimatum for animal experimentation, and world should be prepared to go into transition from animal experimentation to organ on chip model, so that whatever experiment you conduct, you are conducting the experiment on the human rather than trying to do it in the animal model and extrapolate. You made that point, but I'm just making it a little more elaborate for the listeners to carry home the message. Thank you, Dr. Mohanan, for your
Thank you, sir.
talk.
Thank you so much.
Yeah.
Thank you so much.
The organizers are grateful to you. The society, our society, is also grateful to you. Thank you so much.
Thank you so much.
And now it is Dr. Patil has is with an announcement. He is coming up. Please listen.
Thanks a lot, sir.
Thank you. Bye. Bye.
With this lecture, we have come to the end of first slot of sessions. I am thankful to all the speakers, Dr. A.B. Pant, Dr. Francois Puskate, Dr. Adrian Smith, and Dr. P.V. Mohanan. After this slot, we are going to have a short tea break of 20 minutes. We will be joining on the same link again at 7 p.m. sharp. And the next talk will be by Dr. Thomas Harton. Okay. I invite you for that talk after that gap of 20 minutes. Please be with us. Please join again. And I'm ending this session, and I'm also ending YouTube streaming of this session at present. We'll be joining shortly after 20 minutes, and we'll be continuing the next session now. Dr. Akbar Shah?
Yeah.
Yeah, is that okay?
Yeah, that is okay. Yeah, that's the schedule.
All right.
To go through the schedule.
Yeah, I'm closing this session now, and we'll be meeting after 20 minutes.
Yeah.
Please
Thomas
enjoy.
is already